Let's just go through all the honourable members online. If you can just introduce yourselves, please. We've heard from Honourable Mavimbela. I will come to the members that have come in. Honourable Mavimbela, thank you for introducing yourself. Honourable Glungwane, who else is online?
Hi, Chair. Angela Biela, member of Scopa.
Thank you, Honourable Biela.
Thank you, Chair. Honourable Glungwane here. Now, I wanted to raise that issue, but you said I'm always on order. So because I don't want to mess up your meeting, I decided not to raise it. So, but I'm Mthandeni Glungwane, the member of Scopa. Thank you so much.
Yeah, who else? Okay, I believe that's everybody, all the honourable members online. And once again, I do apologise profusely. I'm sure you will forgive me in due course. All right, then there were some members that came in a bit late. Honourable De Boer, and then if we can just go down.
Good morning, Chair. Honourable Chantal De Boer. I'm a member of the Health Portfolio Committee. Thank you.
All right, so if we can just go down there. Honourable Dirks, you had some members who came in a bit late. If you just want to introduce yourselves, those who were not here.
Good morning, Chairperson, MPL members, members of the committees, as well as my officials. I'm Honourable Oleso Hadebe, MPN.
Thank you, Chair. Morning to the department and colleagues. I'm Dr. Mphikeleli Mthethwa, in the member of the Health Portfolio Committee.
Good morning, Chairperson and colleagues and department. My name is Patience Gamede. I'm the member of the Health Portfolio Committee. Thank you.
Okay, have I covered everyone? Is there anyone I've left out? I don't want to make that mistake again. All right, members, I think we are now all properly. Sorry, there's somebody else, another hand.
Good morning, Chair. My name is Erin Sampson, and with me I have my managers, Priska Bdadla and Tibeka Mfumana. We are representing the Auditor General observing the meeting. Thank you.
Thank you very much. I will give you an opportunity after the presentation from the HOD if you would like to say something before we get into questions. Okay, thank you very much. Sorry, who else?
Morning, Chair.
Yes, Chairperson of PAC.
Good morning, honourable members. My name is Zwile Zulu. I'm present in a meeting representing PAC. Thank you.
Thank you very much. Okay, have we covered everybody? Right, let's get into the business of the day. HOD, you've sent through your responses. We have all read them. So one thing we don't like is to be someone to read a document to us that we've already read. So I would like you to take us through the document, but the highlights. Okay, so you don't have to read it word for word. Take us through your presentation, to your document, and I'm going to give you 30 minutes to do that, so that we obviously have quite a busy schedule today, but I'm going to give you 30 minutes to do that so we can spend most of our time on questions, okay? All right, thank you, Acting HOD. You may proceed. If you can just once again speak into the microphone, your CFO as well, speak into the microphone so we can get you on record properly. Thank you so much.
Thank you, Chair. Good morning again, honourable members. The CFO will take us through the document, taking into cognizance the Chair's comments about not going through every line, but just bringing up the highlights for each of the resolutions. Thank you.
Morning, Honourable Chair, honourable members, HOD, colleagues. I'm going to take you through a Scopa resolution and how we resolved on uncertainty relating to future outcome of litigation. were required to bring the breakdown of medical legal claims per hospital, age, value, nature of each claim. There's an attached Annexure A. The number and value of the claims that were successfully defended in 22-23.
Chairperson.
Members, we are just waiting to get the presentation up on the screen so we can. Yes, is the hand.
Sorry, Chair, we did not get the Annexure A, the document that the CEO is referring to. We did not get it on email.
Yes, that is correct, because obviously you're not Scopa members. But sorry, pardon? I can't hear you if you don't use the microphone, gentlemen.
Chair, I also didn't get Annexure A, notwithstanding the fact that I am a Scopa member.
Okay, I've got 4 people speaking at once.
And
what is the difficulty? We can obviously share the document. It was sent out to all Scopa members.
Chair, also Scopa members, we don't have it. There's nothing to share when you don't have.
Also the Scopa members?
Yes.
But it was sent to everyone?
No, we don't have it.
All right, well, I will ask Cabo not to share it with you immediately. Sorry? Okay, Cabo will send it to you, but I've received it some time ago, and then I've received it again yesterday. It was sent yesterday because I asked Cabo the day before each hearing to send it through again, just in case it got lost in previous emails. So he will send it again now. Can I please ask it at our break after this that you just chat with Cabo to make sure he's got your email addresses? Because I'm quite certain he has been sending it to you, but anyway, I want to make sure that that is solid. Thank you very much. All right, do we have the presentation up yet? If I may say, we really should not have this type of delay. We know what we're doing at a certain time on a particular morning. We know which presentation is going to come up. It's unprofessional that we should sit and wait like this. It should be ready and ready to go. Please make sure this doesn't happen again. No, that's not the right one. Is that the correct one? I don't believe so. I'm working off a different document. I'm not sure that this is the correct one. This is not the right document. We got this document. This is not what you sent us. This is what you sent us. No, but they can't come with another document this morning. This is what we got. That's the one we got. I don't know if this is a new document that's been drafted for today's presentation. Is that correct? I have a document that was sent to us, seems to be undated. Perhaps it's dated right at the bottom. This is dated 20th of January. That is the document we are working from.
The document that was sent in January, Chair.
Sorry?
That was sent in January.
20 January.
January, yes.
Yes. But this document you got, the document I have is a PDF document, and the document you just put up now is a PowerPoint. You cannot come with a new document this morning. Do you understand? Because we don't have sight of that document. We don't have this document here. We don't have this. You have not sent this to us.
Yes, we put it in the PowerPoint, Chair, so that it could be.
My point is you haven't said. Okay, well, but my point is members are now following with the document that we have, and you're in a different document. Do you understand?
Yes, Chair.
Because your document you sent to us is actually quite good in terms of it sets out the resolutions, and then in your response it sets out the resolution and the response, the resolution and the response.
Yeah.
It's very good to be able to follow.
Yeah.
You must press the button down.
The PowerPoint presentation, Chair, is in the same format as the Word document. It's just that it's in PowerPoint, but it has got the...
Members, are you happy to proceed on that basis? Or would you like us first to receive this document and then we can follow? Or are you happy to receive? You happy to proceed on this basis?
I think it will be good, Chair, if we just proceed. It's the
Honourable Turks, are you in agreement? Okay, the PowerPoint one.
I'm in agreement, Honourable Chair, with that. It's the same document in any case.
Yes, essentially it's the same, but as chairperson, I find it a bit unprofessional that you come with another document on the morning. We should have the, but apparently according to Cabo, this has now been circulated, this document. So we can work with this document, but please in future, the document you're going to present to us, send it to us. Okay, in good course, so we can then follow. Then we're all on the same page. Otherwise, members are looking at the document that we received and what's going on, creates confusion. It's not necessary. Okay, thank you,
Chair.
Acting HOD. With that, let's proceed.
Proceed. Medical legal claims per hospital, per annex. Medical legal claims per hospital, per Annexure A as attached or will be sent. Number and value of claims that were successfully defended in 23-24. 4 cases were settled with savings as appended. Claimed in summons 89.65 million. Settled paid to plaintiff 31.96. Total savings 57.69. Assessment of the impact of the lack of proper record keeping. There were no claims that were considered due to lack of medical records. Strategies adopted to mitigate liability in respect of medical legal claims. 5-pronged approach was adopted. Prevention through institutional mortality and mobility meetings, redress, including rehabilitation services, Mediation, including offering rehabilitation within the department. Engagement internally, using the department's own employees who are experts in clinical fields, and externally, using external experts. Rehabilitation, care, and treatment. Progress made in law reform. All provinces have submitted input to the South African Law Reform Council, and National Office is finalizing drafting the requisite legislation. Draft bill is still awaited by the provinces. Unauthorized expenditure, 1.5 billion. In their monitoring report for November 2024 is indicating strategies that have been adopted to reduce and also take measures to prevent future recurrence of unauthorized expenditure. We have established work stream to assist the costing and implementation of a multi-year plan and a turnaround plan, which will take in the region of 3 to 5 years to fully implement. Payables not recognized, 879 million. We've issued circular G77 in December 2024, aimed at centralizing procurement as well as issuing orders, and only orders that have been approved and are in line with the cost containment measures. We've engaged Treasury in terms of communicating and agreeing on the turnaround strategy, and the cash flow management is managed so that we can pay within 30 days. Compliance with key legislation with regard to expenditure management. We are replacing expired contracts for services such as security and cleaning services, but the delay comes from those who are appealing the outcome of the bids. So the implementation is progressing slowly. We are 50% there. The panel of cleaning service providers is in the process of being finalized. Compliance with legislation, expenditure management, payments within 30 days. We have negotiated with some of the service providers, particularly the big one, to extend the repayment terms to 60 and 90 days, since if we have an agreement that we can pay beyond 30 days in writing with the suppliers, that is viewed as acceptable. However, we embark on paying within 30 days those that we can under the cash blocking circumstances. Revenue management. We're involved in steps measured aimed at collecting revenue from all sources of income. That includes road accident fund, procurement and contract management. The consolidated findings from AG have identified various transactions that have internal control deficiencies across the province and are not in line with the SCM standard operating procedures. In addressing those, there were workshops with the officials in the district offices as well as various facilities. All 11 districts were prepared and workshopped during the third quarter of the financial year, whereby we bring awareness to all the findings that were raised by the AG, and we targeted all officials involved in the supply chain management process. Goods and services of transactions value above R1 million. Those have also been centralized for procurement in the head office. And the awards to bidders based on evaluation criteria that were not stipulated, or awards to bidders based on preference points that were not allocated and calculated. We have issued and implemented Circular number 70 in August 2024 for compulsory use of the specification form, evaluation criteria forms for quotations, as well as specific goals for evaluation criteria and specifications.
Yes, Honourable Dirks.
Chairman,
Honourable Dirks, can you just wait till I recognise you, please? Yes, Honourable Dirks, please carry on.
Sorry, Chair.
No problem.
Yeah, Chairman, I don't know if there's not a point of order or what is this point, but I'm battling to follow here. I'm battling to follow it. I can't follow. You know, and I don't want to sit here and then pretend that I'm understanding what's going on here, and then I don't understand. So I'd rather raise it with you, Chair. Maybe you can help me, Chair. Like on 13, I'm trying to follow here that on page 13, there is the committee result, the accounting officer report to the committee by 31st of January 2025. Now, and it's list what they must report on. Have we received that report? Because I see them reading through this here, but I don't see the. Excuse me?
So sorry to interrupt, honorable member. I think they are on page 8 and we are looking at the different pages now. All right.
I'm just going back. Yeah. I don't know if we're getting the responses that we are asking for, but let them continue. Let me raise it afterwards. Let them continue.
Honourable Dirks, I'm in the same boat. I'm also struggling to follow because I was working with one document. Now we've been pushed into another document. So I think, would it be helpful if the CFO said we are now on slide so much, moving on to slide and the next slide and the next slide, so we know exactly where the CFO is, and maybe just give us guidance as you go along, CFO. So where were we? I kind of thought we were in slide 16, am I right? This is now the PowerPoint.
Chair and members, we were on resolution 179.
Okay, I think if you can say that, resolution 179, slide such and such, we'd like to follow what you're saying. We really would. Okay, so can you just tell us where we are right now?
We are on resolution 179.
Okay, which slide is that?
Procurement and contract management.
That is slide 13. Yes. Well, I can help by saying the responses where they start is slide 14, but yes, I will now head over to the CFO. Yes, your point.
Chair, you have covered me there.
Okay.
It's exactly his presentation has slide 1, 2, 3, 4, 5.
Yes.
Doesn't you tell us exactly which slide are we on now?
Yeah, 100%. Okay, so please, you must understand, we are looking at a document now we have not seen before. We were working with another document. So we all have this document now, but please just guide us through it, okay? And members, if you're lost, please raise your hand. Please don't feel any embarrassment if you're lost and you need some assistance as to where we are. It's absolutely fine. Honourable Kika?
Chair, it might be slightly different for the committee members. For the health committee members, we received a PDF document containing these slides. But the slides are not equal in terms of, because I'm on page 8, bullet point 3, for example, and you're on slide 13 or something.
See, this is exactly why, but it's exactly, members, why I raised the issue in the beginning. You send us one document and you arrive here with another document. And that's the problem. That's unprofessional. So I don't know, should we perhaps, for the convenience of the members of Scopa, should we perhaps revert back to the PDF document that we received? Okay, let's do that then, because I don't see you have a PDF in front of you. I mean, a device there, so you can't have a PowerPoint in front of you unless you printed it out. I would then like to direct that we go back to the document we received. It's the document dated 20 January. If somebody wants to come and have a look here, I'll show them exactly which document we're talking about. And then we can abandon this because this is not working. Does anybody want to see it? Is there uncertainty as to which document I'm talking about?
Chair, good morning to yourself.
Yes.
Honorable Mbata here.
Yes, Honorable Mbata.
Yeah. Is it possible that the document that you have can be emailed to all of us? Because indeed we are struggling here. And I think you are correct to say probably professionalism, it's needed sometimes, you know, sending this document and come with another document might give us so my request is that, is it possible that you can send it to all of us? And then probably the CFO will have to start from the beginning, because indeed, I'm like Honorable Dex. I have a lot of questions because the committee resolves and stuff, but can we probably have that document? Thank you.
Thank you, Honorable Mbata. Look, it was circulated yesterday, but I've just asked Cabo to circulate the document I'm talking about, which is quite easy to recognize. It's got a KwaZulu-Natal Health, Republic of South Africa, Office of Head of Department, and it's addressed to me, Honorable T. Browderset. That's the document I'm talking about. That will be sent to all members again now. Is there any confusion amongst... I think that's the document that we have up on the screen now. Am I correct? Okay. So now we're going to page 8. Page 8, at the top it says, which page are we on now? Is this still the PowerPoint? Yes, this is still the PowerPoint that's up there. Yo. You know, in the past, departments have been asked to leave and come back organized. This is not acceptable. It really is not acceptable. That is still, the document up there is still the PowerPoint. Because I reckon that had the blue writing. Can we please get the document I have in front of me here? On page 8, it says response to the department. The resolution of the committee is noted appended to the response of the department. Progress made and the outcome of implemented measures to address the findings on procurements and contract management and adequacy of effectiveness thereof to provide a recurrence of the findings. That is top of page 8. I must say this is the first time we've had this in all the Scopa hearings, that we have confusion like this. There we go. That's the document. Right. Now we're making progress. If we can just please go down to the top of page 8, where the words response to the department are. Members, are we good? Are we all good? We all on the same page now? Okay, finally, sanity prevails. Let's move on. Right, so we are now top of page 8. Are you with us, CFO?
Yes, Chair.
We're in the same place. Okay, so your response starts with, it should be noted that the list of findings reflected in the resolution. Okay, great, fantastic. Let's move on. Thank you very much.
Thank you.
Over to you.
The identified internal control deficiencies were largely due to contravention of the SCM standard operating procedures, and in addressing them, SCM workshops were conducted in all districts, all 11 districts, during the third quarter of the 2024-2025 financial periods, and these targeted institutional management teams from district offices, hospitals, CHCs, and clinics. Determination of economical expenditure. We have revised SCM delegations to remove allowance of 20% exceeding cost estimate. This control is designed to ensure that responsive quotations exceeding the cost estimate and the allocated budget are negotiated and submitted to cash flow committee or delegated expenditure approving official to revise cash flow certificates. Goods and services on transaction above R1 million. All requisitions for non-contracted goods and services exceeding a quotation threshold value of R1 million are published on e-tender portal for 21 days. The department also issued Circular 84 of 2024 in September to clarify the reporting requirements for procurement other than by other means or deviations. So these are procurements outside the normal. Awards to bidders based on evaluation criteria that were not stipulated and based on preference points that were not allocated and calculated. We implemented Circular 70 in August 2024 for the compulsory use of specification form, evaluation form, and criteria forms for quotation. This clarifies the requirements for specific goals, the evaluation criteria, and spec. Persons that are in service of the department who had private business interests in contracts. We've revised standard quotation document up to R1 million to include an explanation on how to disclose one's interest. Further, Circular 149 of 2023, issued on the 19th of December, has been circulated, stating the requirements for declaration of interest by both SCM officials as well as other role players associated with the procurement processes. A list of transactions above R1 million without inviting competitive bids where deviations were approved to the value of those transactions and the reasons for the deviations. That is per Annexure B. Details of disciplinary actions against officials who had a private business, interest contracts awarded by the department who failed to disclose such interest, as well as officials whose family members, partners, associates had interest in contracts awarded by department who failed to disclose as such. We have embarked on investigation services to undertake the necessary investigation to provide reports with recommendations or remedial action. Should investigation report recommend disciplinary processes, labor relations sections is then instructed to do so. Compliance with, Resolution 180, consequence management. AG obtained sufficient evidence that steps were taken against officials who incurred. AG could not obtain sufficient evidence that there was There were steps taken against officials who incurred unauthorized, irregular, fruitless, and wasteful expenditure. This was due to proper and complete records that were not maintained as evidence to support investigations into unauthorized, irregular, fruitless, and wasteful expenditure. In instances where there was non-compliance, a case was reported for further investigation. Where fraud was suspected, then investigation was recommended and the necessary disciplinary processes implemented. Further, should a transaction be reported as fruitless and wasteful, it does not automatically suggest to a wrongdoing. It should be noted that consequence management is both corrective and punitive. In some regards, training has been undertaken to address control deficiencies. Disciplinary steps taken against officials responsible for unauthorized expenditure and to recover any losses from responsible officials and the measures put in place to avoid future occurrence. Unauthorized expenditure in certain instances resulted from the budget cuts experienced over the previous financial years and may not necessarily be attributable to certain individual. Since the department is in the front line of delivery of service, core service delivery, so associated expenditure could not necessarily be avoided. There have been no reports suggesting that there are department officials that have been responsible for incurring unauthorized, irregular, fruitless, and wasteful. However, should investigations reveal that officials have done that or have transgressed the procurement legislation, the necessary disciplinary action will be implemented. Robust cost-saving strategies are being implemented to significantly reduce the spending to match the appropriation in medium to long term. That then to demonstrate the department's commitment to responsible financial management. Resolution 181, strategic planning and performance management. The department continues to monitor the facility's progress in how they conduct regular verification of data, and significant improvements were achieved, especially during the visits that were conducted to various facilities and districts. There is a monitoring team that visits facilities and measure the performance using the Performance Information Assessment tool. During Q2 and Q3, the Provincial Data Management Team visited 23 facilities for that purpose. All activities in the audit improvement plans are monitored on a monthly basis, and the progress reports are issued as such. The department programs and heads of clusters host internal reviews to monitor progress of the outcome against the targets. We've put systems in place, developed shared oriented managers on the various monitoring and evaluation regulations, including performance review and reporting guidelines, which then enable accountability at all levels. Annexure E is detailing such. Research guidelines, strategic planning, data management, and monitoring and evaluation is what the management has been orientated on, referred to Annexure F for such. Facilities in Q4 are busy auditing themselves, and this activity...
Chair, on a point of order, Chair.
Honourable Dirks.
Chair, thank you, Chair. Chair, you see, last year we asked specific questions. And I thought when the department comes today, they'll answer those specific questions. Now we get an official coming here and just reading something. Just reading and tell us a whole lot of other things. And not just deal with the specific questions that we ask them. So, I mean, the official is reading and reading what? There's no information that we get. It's just reading. It's reading to us here.
Yeah, Chairperson, sorry, Honourable Dirks, let them finish, and then you'll have full opportunity to... I'll come to you now, a member on the platform. I'm busy with Honourable Dirks. Honourable Dirks, let them finish. I'm also concerned that the acting HOD is not saying a word. It's just all the CFO. You are the accounting officer. Okay, so please, you need to take responsibility here. Let's allow the presentation to complete. I will give you half an hour to go through every single thing that you want to go through and get proper answers to it. But we need to give them an opportunity to do the presentation, whether we like it or not, Honourable Dirks. There was a question from an honourable member on the platform. I don't know who it was.
Is there a hand? But yes, I'm here. I think Honourable Mbata. Chair, I think
Honourable Mbata, yes.
Yes, Chair. I think our Dex is correct, but because you have ruled that they must continue, but if you did not rule, I would have suggested that, because I feel like as from what happened last year to until today, I think the department is not ready to deal with, these questions that were asked. So, but you have ruled that they must continue. Then after the presentation will come in, but I feel like they are not ready, Chair. But since you have ruled, I will withdraw. Thanks.
Yeah, Honourable Bata and everybody else with the same frustration. We have to have structure in the meeting. We allow their presentation. We allow the AG to come in. We allow Puck to say whatever they'd like to say. And then I will hand over to the members of Scopa first, then the members of the Portfolio Committee, and we can have a really robust engagement. This is when you can express your frustration. But to interrupt their presentation all the time is going to really delay us to get to that point. So let's let them finish their presentation. We are not accepting the presentation by letting them present it. We're just allowing them to do it. So let's follow that procedure, and then I promise you, you will have all the time you want to interrogate the presentation and to really get stuck into the detail. All right, so please, CFO, please continue. But as I said to the acting HOD, please don't read it word for word. Give us the highlights. We are following you in the document. Okay. All right, and I did say 30 minutes. There's been so many interruptions that I'm not even sure where we are there. But please, let's proceed through it in good time so that we can get to the members' questions. Thank you.
Thank you, Honourable Chair and members. Irregular expenditure, 3 billion in 2024 financial period. We're continuing to incur irregular expenditure as a result of continued use of expired contracts due to the delay in finalizing SCM procedures, especially where there are appeals and challenges and were unable to proceed with the necessary appointments. Resolution 183, irregular expenditure, cumulative balance incurred in prior financial years, not yet condoned. The cumulative balance come from as early as 2010 and some are 7 years and older, and they make up 34% of the reported irregular expenditure. We have made attempts to engage SCM. We have also engaged Provincial Treasury, and we have conducted training in terms of preventing irregular expenditure, identifying and detecting irregular expenditure before it happens. The write-off and condonation of irregular expenditure, paragraph F, we've successfully reduced the reported amount by 5 billion through a write-off process, down to 16 billion from the previous 21 billion. We're in the process of engaging Provincial Treasury to further reduce this. And the progress made in submitting information to Treasury, because this is what is then required in order to successfully condone the irregular expenditure that was incurred in the past. It requires supporting source documents that are difficult to establish because they need to understand what had happened before, since this date back to 2010 and sometimes before. Resolution 184, fruitless and wasteful expenditure, 3,948,000,000. And this occurred in the following categories: interest charged by municipalities on late payments. It must be noted that local government charges us interest from day 15 of issuing an invoice. Other interest, 2.5 billion. Expired stock, 389 million. Other, 118,000. In terms of expired stock, we are required to maintain certain minimum buffer stock in all facilities, and they may not necessarily be used, but we must have at least a certain number of days, weeks, or months of supply. Material findings on performance information, district health services. We achieved 97.9% against the reported target of 85.1%. However, the supporting documents that the Auditor General looked at did not reconcile to our recorded achievements. To address this, the district teams have achieved significant improvements, and then we are improving the recording process of such achievement. And we are measuring all performance information related data using performance information assessment tool. Resolution 186, material findings, various indicators. 2 indicators did not agree to what was reported. The actual achievements were estimated, and they were materially less than what was actually reported. In addressing these findings, all facilities are to ensure that there's accurate data capturing at source, and the managers have to review such data and make the necessary adjustments. And then there is oversight where captured information is reviewed by someone other than the person who recorded it. Performance information, ideal clinic status rate, Kwamsane Clinic and Khayelihle Clinic were audited with a view of determining if we have reached the ideal clinic status, and there were certain findings by the Auditor General. And the update on those findings is as follows. We're not adhering to cleaning schedule, and this could have negative effects on infection prevention and control at the clinics. We have identified that in both clinics, and cleaning is being carried out in accordance with the cleaning schedule. We have engaged general assistants and EPWP staff on the cleaning program, and they've been trained to deal with infection prevention, to deal with cleaning the clinics. And we have nurses for infection prevention and control who ensure adherence to IPC guidelines. Various indicators. Some of the supporting evidence was not provided for auditing to the Auditor General, and the department did report back to the AG that the sample sizes and the patient satisfaction rates were auto-calculated by the survey system, hence not all the information was provided. And in addressing these findings, initiatives have been developed to address the findings, adequacy, effectiveness of controls. In this regard, it should be noted that district management shared the outcomes of regulatory audit with the respective facilities on performance information findings. And evaluation teams did engage to monitor the improvement at facilities. 23 facilities were visited during Q2 and 3 to verify any improvement that were undertaken, and there were plans that were developed and implemented to be compliant. Resolution 189, District Health Services and Program 4, District Hospital Services, is the same as the previous finding on targets. Certain targets set in APP are prescribed by National Department of Health, and it's not always possible to find linear correlation between the targets as well as the budget spent, especially because of the budget cuts. So the summary of the processes undertaken in developing the revised APP for 24-25 are presentations to the 7th administration of the APP review, 2 August, internal consultations with program managers, August to September 2024, circulation to MENCO for final input and adopted by MENCO in September 2024. This is now saying the APP and the budget are in line, and what we set as targets is measurable, and it meets the whole SMART criteria that the Auditor General is expecting, which is a specific, measurable, achievable, target-driven, and outcome-based. Misstatements, annual performance management. There were misstatements in the annual performance report submitted, and those misstatements were in the reported performance information for district health services and hospital services. The management could not correct the misstatements on time during the time of the audit. In this regard, training was conducted with various facilities, and the audit improvement plan using generic reporting template was developed, and then the district was supported in how to go about capturing data and reporting on the correct statement. Material irregularities, interest on overdue accounts, 2 million. The final account is currently under dispute. A proposal for a settlement agreement has been vetted, and the whole balance that was remaining on 31 January of 640,000 has been resolved through recovery, since there were still some huge amounts that were due to the supplier. So this matter is settled and covered. Investigations that were embarked upon, they covered maladministration, petrol card abuse, sexual harassment, claims against the state, fraud, theft, misconduct, HR irregularities, nepotism, ROPS, SCM irregularities, 29 cases in total. And of the 29 cases, 8 were completed, 8 were closed, 10 are at the reporting stage, 3 were finalized. Infrastructure projects upgrade in Kzn Hospital. There was 21 months delay, and measures to implement and finalize the defective work were undertaken, and the investigations were done in terms of what caused the delay. Construction of Dr. Pixley Kaisaga Seme Memorial Hospital. The outcome of the implemented turnaround plans and steps taken to remedy the outstanding and defective work and to complete additional work, as well as timelines for completing all work, implementation of AG's recommendation. In respect of Ward 2, there was not in news. It should be noted that Ward 2 was affected by October 2017 storms, as well as to April 2022 storms, but the work that was supposed to be done to address that storm or those storm damages has been done, and the SCM has awarded and appointed the service provider. Ideal Hospital, Church of Scotland and Charles Johnson were audited for Ideal Hospital. And the findings were poor stock management in relating to the stock levels for medicine on the stock cards that did not correspond to the stock on hand. We have implemented the requisite controls and ensured that stock cards are properly maintained. Emergency power supply that was not available. We could not then go ahead with the backup power supply due to department's cost-cutting measures that said non-essential generators cannot be then implemented. Generator capacity for Charles Johnson Memorial connected to the laundry and theatre was upgraded from 500 kVA to 650 kVA. Human resources not in line with the approved staffing plan. CEO post is currently vacant, and there was advertised buildings not maintained and non-compliant to safety regulations. We have commenced with engaging service provider to address those findings. Resolution 196, Ideal Hospital, medical legal claims. To ensure that the medical legal claims are managed efficiently, we have embarked in the process of finalizing new tender to reactivate the system, and department awaits the outcome of this. The AG recommendations were implemented to ensure that ID numbers for all new medical legal cases are received and recorded on the database. The activities of the SIU also play a role with queries about the attorney's motives and practices that were discovered. I'm sure everyone was aware of what is happening when it comes to medical legal malpractices by attorneys' firms. And we prioritize resources within the restricted funding envelope and available budget to ensure resources are available to manage and safeguard medical legal claims information during the 25-26 financial period and MTEF period. Thank you, Chair and honorable members.
HOD, anything you'd like to add? Actually, acting HOD, anything you'd like to add?
Okay, thank you, Chair. Good morning, honorable members. What we have done in the department, particularly to address most of the findings by the Auditor General, is to put in task teams that are going to be looking at all the business processes around compliance with supply chain management, with finance, as well as with performance information, that on a regular basis are actually visiting facilities to ensure that the processes, the systems, the guidelines, the circular are being adhered to. Over and above, we have issued a number of circulars that are going to guide staff in terms of compliance and adherence. However, we note the concern by members about the document, and also how they could not find the sync and the linkage between what we are presenting and what we are referring to, given that we are referring to annexures that they are not looking. If we could be allowed, Chair, next time, maybe we could hyperlink the documents as documentary evidence for each and every resolution, so that when we then present that resolution, we then go to that documentary evidence and try and actually present to the honorable members the evidence that you are talking to, and how that evidence actually assists in making improvements in terms of the audit findings, so that the honorable members can actually relate what we are saying in terms of what was done and what is documentary evidence. For instance, if we're saying we have visited facilities, we need to show documentary evidence of the reports and the improvements in real scientific data. For instance, if we're saying there was improvement in some indicators that the AG found that there was no consistency between those, we need to produce a quarterly report that would show the improvement, just a snapshot of that would show that, so that the members could actually relate what you are saying on the document with the documentary evidence. It might be a lot of documents to attach, but I think it would assist in following up. That is what we would, if we would be allowed to do that, to hyperlink some of the documentary evidence to the report, so that we can talk between the two reports. Thanks, Chair.
No, that's fine. I'm quite certain we will see you again, so we can perhaps address that at that point. Honourable Dirks, I know you're championing the bit. I will definitely give you the first chance at this. AG, is there anything you would like to add? Anything you'd like to contribute to the discussion or not?
Good morning, Honourable Chair. No, the AG has just started our planning process for the department, so we will be following up on these presentations in that process. Thank you, Chair.
Thank you. Anything from PAC?
Morning, Chair. Thank you so much for the opportunity. Ourselves, we are mindful of the presentation and we monitor it ourselves when we deal with the item of audit action plans and our audit log. Fortunately or unfortunately, this department is no longer audited by the internal auditors they have. Is their own team that is outsourced to themselves. We, as from Treasury team, from PAC team, we don't have individuals who are auditing this department due to a resolution of our cabinet some time ago. So we are also considering to bring them back. We are in negotiation to say maybe they need to come back so that we start auditing them, but we haven't met them to look at the plan for this year, for this administration. We know they are completing the plan, the 3-year plan they had for the previous administration, but as we go along, we'll then be able to meet them. We were planning to meet them in December to look at their strategy so that we plan for this administration, the 7th administration, and look at where we could focus on in terms of auditing and finding out on those findings that were not achieved during the year as to how do we assist them on that. So we are at that stage at the moment, and the plan is to have a meeting, one-on-one meeting with the CAE for the department so that we structure our work relationship. This meeting is taking place on the 28th, I think it's Thursday. Thank you.
Right, thank you. Let me get the hands. I've got Honourable Dirks first, then Honourable the Clerk, Honourable Khadebe, Honourable Naya. That's it for now. On the online platform, are there any hands?
Yes, Chair. Honourable Mbata Moyo here.
Honourable Mbata, yeah, got you. Okay, sorry, maybe I didn't explain. What we do in Scopa is we allow the Scopa members to ask questions first, and then we will come to the portfolio committee members. We focus on Scopa issues here, so very much on this report. So portfolio committee members, you are really welcome here, and we're happy that you're joining us because obviously you have specific knowledge of the portfolio. But if I can ask you, confine yourself to Scopa type questions, not about policy, strategic direction, etc., etc. We are dealing really with accounting matters here. All right, I just want to make sure. So we've got Honourable Mbata. Have I got everybody? I've got Honourable Khadebe, Honourable de Klerk, Honourable Dirks, Honourable Naya, Honourable Mbata. Not in that order. And sorry. All right. Okay, am I missing somebody there? Honourable Dirks next to you. Sorry, remember?
You are missing Honourable B.M. Kzn.
That's right, yes, okay. All right. All right. So the order I've got is Honourable Dirks, Honourable de Klerk, Honourable Khadebe, Honourable Naya, Honourable Kzn, and then Honourable Mbata on the platform. Just remember the way we do this. Please understand, Honourable Dirks will start off. He'll ask questions, and it's a back and forth. Okay. Until Honourable de Klerk Honourable Dirks is satisfied, then he will hand over to the next member. All right. So it's back and forth. It can be robust. Okay? And unless he's swearing at you, there's very little protection. We want proper answers here. Okay? All right. Honourable Dirks, over to you.
Thank you, Chairperson. Chairperson, the last speaker on the virtual platform, the information he shared with us is extremely worrisome and also unacceptable. And I want to urge him that as soon as possible, that they bring that audits back, that they don't outsource the audit process to be done by outside or auditors. So if we can deal with that matter, because that is very concerning.
Sorry, Honourable Dirks, can you just move the mic a bit closer to you? I know you're going to make really good inputs here, and I really want to get it properly on record. Thank you.
Thank you, Chair. Thank you, Chair. Yeah, Chair, I'll be very brief. I will just deal with Resolution 180 of 2024, and I'll just deal with Resolution 1 and 2. And the reason why I'm doing that is because I want to point out to the officials and to everybody in this committee how useless this information is to this committee, and how this information is absolutely not helpful to us. I will not labor all the points and go through everything, because if I must go through everything, we will expose this department very badly. So I'll just deal with Resolution 180 of 2024, 1 and 2. But before that, I go into that. Where's the HOD that we were dealing with last year that appeared before us? We can just get an answer to that. What's his name? Dr. Shabalal. Where's that HOD?
The HOD's contract ended end of January. MP, Honourable Member.
Oh, his contract ended end of January. Okay, and you all just decided to release him without even filling the position of a new HOD. No, you can shake your head. I'm asking these questions. That's the reason I'm asking these questions.
What? Thank you, Honourable Member. What I'm aware of is the post was advertised in December, but I'm not aware what the processes are going forward. But there was an advert in December before he left. Thank you, Honourable Member.
Yeah, no, I'm asking this because we're looking at trends in different departments. When posts come to an end, you don't find the HOD, head of department, just gets sent home, packing to go home until that post has been filled. So I assume there's some kind of different kind of trend in the health department, but that's fine. Let me go to my question. The committee resolved under 1.8 of 180 of 24, the committee resolved 1. Disciplinary steps taken against the officials responsible for the unauthorized expenditure in terms of Section 38(1)H of the Public Finance Act of 1999, read with Treasury Regulations 9(1) and 3. 2. Steps taken to recover any losses from officials responsible in terms of Section 38(1)C of the Public Finance Act of 1999, read with Treasury Act. Now let's go to your responses. Now, you are making a very bold and unambiguous statement here in responding to this committee. You are saying that cognizance should be taken. This is your response to unauthorized expenditure. Cognizance should be taken of the fact that the unauthorized expenditure incurred had resulted directly from the budget cuts experienced over the previous financial year. You are saying that the unauthorized expenditure is due to budget cuts. Now, as senior officials in the department that have been through workshops, that have seen the new program and policies of this current administration, you know that the current administration is going through some belt-tightening exercises. You know that there will be cuts in budgets. They are trying to save costs. You know that there will be austerity measures. That is the direction, when you read what's happening, that's the direction that this administration is going currently. So does that justify you to have unauthorized expenditure and blame it on the administration for budget cuts? Because we may experience further budget cuts this financial year. So does that justify the department, because there's budget cuts, to say that that will result directly into unauthorized expenditure? Can you please respond to that?
Okay. Thank you, Honorable Member. We note your comments, and the unauthorized expenditure may not be justified. However, there are instances where the department has been faced with issues of funding compensation of employees, which is under-allocated in terms of the budget appropriation for the year. As much as we are implementing austerity measures, trying to cut down on some of the issues, the staff that we have still has got to be paid. And compensation of employees take a larger bulk of our budget. That is then further compounded by the unfunded wage agreement, which then increase the expenditure on COE. So that as much as you would have put in austerity measures, you make a savings, but you do have staff that has got to be paid. If I can make an example, Honorable Member, just for 25, there's already a 5.5% salary adjustment. And we're also going to be having to implement also a 1.5 pay progression. Currently, according to our current financial year appropriation, we have allocated 35 billion for compensation of employees. This 5.5 salary adjustment and pay progression adds another 2 billion into the costs. Whilst unauthorized expenditure may not be justified, but there are circumstances beyond the department in terms of the budget allocation. However, where there are instances where compliance has not been adhered to in terms of SCM regulations and other policy and other guidelines not adhered to, that results in unauthorized expenditure. That is where we are focusing on to ensure that there is compliance, that all guidelines, processes, and prescripts are adhered to avoid unauthorized expenditure related to non-compliance. But most of it is related to budget cut because we run out of budget early in the year, but still have got to run services, still have got to pay the employees that we have in the system before we even think of filling any additional posts. Thank you, Chair.
Chairperson.
Honourable Dirks, can I just jump in here? I just want to remind the HOD of something. You're obviously familiar with the Public Finance Management Act.
Yes, Chair.
And you're familiar with the fact that it's a piece of South African legislation.
Yes.
And that unauthorized expenditure, irregular expenditure, and fruitless expenditure is actually an offence.
Yes, Chair.
So you're committing offence. No, I want to leave that with you. And then I'll go back to Honourable Dirk.
Chair.
Thank you.
Chair, I understand the issue of, my question was not about unfunded mandates and the wage negotiations and those unfunded mandates. I understand those issues very well. What concerns me is that the statement has been made very clear that they're going to have unauthorized expenditure in every financial year, because they said as long as this administration cuts the budget, they'll have unfunded they'll have unauthorized expenditure. Now, as I'm going to we don't agree with budget cuts. But if the administration cuts the budget, we will never defend any department that do unauthorized expenditure. You work as an official, you work within the budget that the administration has made available to you. And you can't come here and tell us about unfunded mandates, about the salary increases. That's totally unacceptable. It's totally unacceptable. And as the chair say, you are acting illegally. It's a criminal offense what you are doing, and that's why I asked, where's that previous HOD that was here? So that's not unacceptable, and this just shows the kind of responses we receive from the department. They give us such kind of response, and you'll cut the budget. That's why we have this unauthorized expenditures. Unacceptable. Then the last point, you respond to us also. You are saying it is important to note that this cannot be attributed to any individual. Unauthorized expenditure cannot be attributed to any individual or individuals, as the department is at the core of civil service delivery, goods and services and all that and other service delivery associated with expenditure could not be reduced overnight. In light, I can't see it's cut off here, although I think in light of the aforementioned, it should be noted that there have been no suggesting that there are departmental officials that have been, and I just see arrests for incurring unauthorized, irregular, and fruitless and wasteful expenditure. However, should investigations reveal that officials have been responsible for these transgressions, the necessary disciplinary action will be implemented. I will stop there. Now, you see the response here. For unauthorized expenditure, no one is to be blamed in the department. No one. There's no one to be blamed. The department is not to be blamed. The officials are not to be blamed. No individual official is to be blamed. The administration is to be blamed. That's basically what you are saying. You are saying that this administration, current administration, is to be blamed for wasteful, for unauthorized expenditure. Now, that cannot be. That cannot be. You work within the budget that you have been allocated. You make and do within that budget. You have no right. You have no legal authority to overexpend, to have unauthorized expenditure. You have no legal authority to do so. But you come here and you try and justify this here. And that's why, Chair, I said, the answers in this report, responses to what we have asked, is totally useless, and fruitless and wasteful to us here. It's of no value to us as a response that we have received. But I don't want to go through all of them. I just want to take these 2 points just to make an example of how officials respond to us. This is the response that they give us, and they expect us to accept such responses. In this one, they say there's no wasteful, fruitless expenditure. But later in their report, they raise issues about people that have been charged for wasteful and fruitless expenditure. But they said there's none. But now later on they said there is. So this is the kind of responses we are getting from the department, which is totally unacceptable. And I will leave it there because I'm totally unhappy with these responses, and I cannot accept such responses. Thank you very much.
Yeah, Honourable Dirks, I think if you compare it to the spreadsheet we got from Public Works, their consequence management, it's night and day.
Yeah.
In terms of level of detail, you know. Yeah, I actually want to go to Public Works and say to them, can you vacate all the detail in that thing and just give it to us so we can give it to departments and say, when you respond on consequence management, that's what it needs to look like. Because that was really, really good. Okay, let's go on to the next member. Honourable, was it Honourable de Klerk? I think it was.
Yes, Chair.
Yes, thank you, Honourable de Klerk. Please take it away.
Yes, Honourable Chair. It seems my discussion this morning with Honourable Dirks lit a fire, and I'm so glad about it. HOD, every year you prepare a budget. When you prepare that budget, you know the realities. You know there's budget cuts. You know there's going to be an unfunded mandate on salaries. You know all these things. Is that correct?
Yes, Honourable Member.
Yes. So what's going on with your budget then? because if we look at the Auditor General's report, you failed on every conceivable point. Irregular expenditure, unauthorized expenditure, fruitless expenditure, material misstatements, and it just goes on and on and on and on and on. Why? Why on each and every thing in this post-mortem you failed? There is not one light point. There's not one thing that says, wow, let's see what has happened here.
Thank you, Honorable Member. We take cognizance of your comments. Some of the irregular expenditure is historical, and that is what we have been working on, being supported by Provincial Treasury, particularly those that now we are working on the process of condonation. And in that respect, there has been significant reduction in the irregular expenditure. However, we are still working on those. I think the relationships that we are beginning to build with Provincial Treasury, whereby we are setting up work streams that will be jointly implemented by Provincial Treasury and ourselves, are going to assist us in order to deal with these issues that Honorable Member has raised. Last week, we wrote to the HOD for Treasury, fast-tracking the discussions that we started in December in order to support the department to deal with these issues. And also our risk management committee is meeting on a regular basis, and we acknowledge the committed support from PAC to actually put in systems in place through compliance with risk registers at every level of service delivery. Our facilities now have identified their risks. They have got risk registers in place. We are implementing risk mitigation strategies. We are workshopping our staff to actually identify all aspects of risk, particularly around compliance with all the prescripts as you have been responded to. We are committed to actually reducing all the audit findings in these areas. We have started to do that by also putting in a system, Logis, at a provincial level, which has provided evidence that if we have this system, because this system says when you capture any transaction, to make sure that the budget also, the procurement plan and the budget is allocated. So that system then make sure that for every transaction or goods or service that you procure, it ensures that there is budget allocation. And therefore, in that way, we've seen a reduction using that system in terms of irregular expenditure. So we are hopeful that the systems that we are putting in place, including the use of our goods received note, are all the efforts that we are putting in place that will ensure that we reduce the fruitless and waste and irregular as well as the unauthorized expenditure. Thank you.
Yeah, on that, I hear what you say, but it's still very problematic because in the same breath, and that's what Honourable Dirks also alluded to, in the same breath you're saying, look, we know when we prepare our budget that there's cuts, we're going to have a shortage of money. We know all those things. But notwithstanding that, we will incur unauthorized expenditure because we health, we're important. So because we are what was said, a core frontline service, we do not have to worry about the PFMA. We have to pay. Salaries is a lot, but we also have to give services. So forget about our budget that took into consideration all of these issues. we will pay out the salaries or whatever else. You understand? What's the difficulty here is you have the information when you prepare your budget. When when the issue arises, you say, we record service, we have to pay out. So now we're paying out money that we don't have, and that's why it's irregular.
Honorable Member, the provision of what is happening, as I have earlier alluded to on, is the dilemma to strike a balance between compensation of employees and goods and services.
Yes, just I'm going to interrupt there. That is the problem, because at the moment there's no balance. The balance lies with salaries. It's not balanced, it's imbalance. Because all the money goes to the salaries, and halfway through the year, in your own words, you run out of money from your budget. Now you can't give service. The one thing that will happen is people will get their salaries. But those that are ill and needs to be helped because they might die.
Yes, Honorable, what we are doing, we have put together a detailed cost-saving plan that is going to look at areas of cost saving so that we can ensure that we are able to provide the services. We have shared that cost-saving plan with a provincial treasury, and we are going to be monitoring it on a daily basis. We have attached a monetary value to each and every cost-saving initiative so that we can check at the end of the month whether we have realized those savings or not. In addition to that, we are also looking at how we can re-engineer some of the services. We are looking at discussing with Treasury how we can ensure that the staff, the staff, we have an essential post list staff that ensures that we do not blow our staff complement. We remain with what we can function with. We've spoken to our facilities to implement task shifting so that we have staff that can perform to do a number of tasks rather than increasing. We have streamlined the recruitment of posts so that the approval is by senior management, so that we ensure that we don't incur additional expenditure over and above the staff that we have, so that we focus on our core business. We have brought back the issue of ring fencing the budget for the non-negotiables. We have a list of 14 items that are called non-negotiables in health, whereby those items, you make sure that you fund those in terms of our good services. Your medicine, your vaccines, your cleaning material, your safety and security for patients, and your laundry service and so on. So our plan is to make sure that we budget accordingly for the 14 non-negotiables in the Department of Health.
Yes, ma'am, but that's the problem. You say you budget correctly and properly, but the facts that we say is contrary to that. The facts is your budget doesn't work. Halfway through the year, the money is finished. Now, even with cash blocking, it stops you from spending money. You're still getting to a point of no return. The worry that I have, sitting in this committee for years, I've heard these recovery plans for many years. I promise you, ma'am, coming the next audit report, you will see the same problems. And thus my question will then be, who's going to resign? Because we cannot carry on year in and year out with the same high irregular expenses, same high fruitless, same no disciplinary steps to be taken. As the chairperson said, you know it's a crime. You know you can't pay out money contrary to a PFMA, but we're special. We don't fall under that. We carry on. So I'm finishing off on this. I do not have faith in these plans because of the past. I'm begging you to prove me wrong. I want to be wrong. I don't want to be right. Please prove me wrong. Come, when when the next audit report will come, it must be a good one. If not, I really, really believe that some of you will have to resign because you are not able to fix it. I think that's a fair request. I see you positively shake your head. Thank you, Chair.
Thank you. All right, on with the clerk. That's great. Let's go to Honourable Khadebe. Floor is yours, Honourable.
Thanks, Chairperson. Unauthorized expenditure in the context of government departments in South Africa, including your department, Department of Health in KZN, is primarily governed by the Public Finance Management Act of 1999, which states that public resources are used efficiently and effectively. To mention but a few, unauthorized expenditure. In Resolution 174 of 2023 state that there was an unauthorized expenditure of about 1.5 billion. 1.5 billion. This implies that the expenditure was incurred without proper authorization. My question is that, could I confirm whether anyone has been charged in connection with this unauthorized expenditure? If not, could you explain why? Could you please mention the names and surnames as well as the total number of those that needs to account? And how far with this process as per Resolution 192 of 2024? I submit, Chairperson.
Thank you, Honourable Member. I will respond and then CFO will add. What we have started is what we call determination testing, whereby we are investigating these issues of unauthorized and irregular expenditure. We have started with the finance aspect, and we are going to move to SCM. Once we get the reports in terms of the determination testing, it will then provide us the details of who undertook all those transactions. Did they follow all the processes as per the SCM and finance prescripts, the PFMA, and then we then are going then to look whether there was compliance or not compliance.
But you're supposed to have the list of those who do this unauthorized expenditure. There must be suspects on this one. Please provide the names and their surnames or just the number. How many are those?
Thank you, Chair, honorable members. If you go to Resolution 192 as quoted, on the issue of investigations, the response is tabling the number of cases that there were 29 cases that were investigated between 11 August 2023 and 1 January 2024. And there's a status. How many cases were completed? Of the 29, 8 closed, 8 reporting 10, finalized 3. There's also a recommendation.
Sorry, Mr. Vilakazi, if that's what you're relying on, if that is what you're relying on, I agree with Honourable Khadebe. That's not a list. That's a general overview. What Honourable Khadebe is asking you is, who are these people? Now, I've got, and I'm not trying to take your thunder here, Honorable Khadebi. I'm trying to support you. I've got a SIU list. And SIU have taken legal advice. We had for those of you not present, we had a workshop with them in December last year. And I said, I want detail like Honorable Khadebi is asking for. And we received that after they took legal advice on it. That's what Honorable Khadebi is asking for. These general overviews, and I'll refer back to the Public Works list. So please, don't tell us this now. Honorable Khadebi is saying, who are these people? Is it Tim Browderset? Is it Imran Kika? Is it Chantal de Boer? Tell us who it is.
Unless, Chairperson, if
we
there
need a list like that. Thank you, Chair. Thank you, Honourable. Please carry on. I'm just supporting you.
Unless if they are just invisible person, then you not tell us.
So, and the other thing I just want to jump in here. This, please forgive me if I'm wrong, members, but I see a new term has slipped into the ecosystem of Scopa, determination testing. This seems like a new term, and I've been around a long time. You know what that sounds like? Kicking the can down the road. So you've got a matter sitting on for 3 years. Oh, no, now we're going to do determination testing to see if there's a prima facie case. And I can see in your explanations here that you don't have a concept of how disciplinaries actually work. You say that you must prove on a balance of probabilities in the investigation for a case to continue. Can I just correct you? And I've got some lawyers here. You're looking for prima facie, which prima facie is Latin. Okay, we don't need Latin, but it basically is on the face of it. If we just look at it, there's a problem here. Doesn't mean we've proved the case in the investigation. You prove the case in the actual disciplinary inquiry or in court. But on the face of it, hey, something's not right here. So this determination testing is a way of saying, if we can determination test for another year, then nothing happens. Am I right, members? So this determination testing is just for me, and you're talking about starting determination testing on matters from August 2023 to January 2024. So now at least 2 years old. Anyway, I'm just making some comments here. Can you just respond to what Honorable Khadebi asked you now, please?
Thank you. The names are available and we'll provide them as they are available within our departmental investigation unit. Thanks.
Honorable Khadebi, are you, please continue. The floor is still yours. No, Honorable Khadebi, I'm just saying the floor is still yours until you say I'm done, and then we'll go on.
Okay.
So if you have further questions, please continue.
I don't think they have answers. They don't have appropriate answers which we expect from them.
Honorable Khadebi, if it gives you some comfort, one of the resolutions will be is that we ask for that list from the department. So that, Honourable Clerk, you wanted to make a quick point before I go to Honourable Nine?
Yes, Chair, it's on, sorry that I'm jumping in now, but it's relevant. Determination testing. How on earth do you do that? Because there's no prima facie case. There's nothing. So I look at the documents and I say, I don't think there was fraud or any wrongdoing. Please be so kind to enlighten us this magic testing. How does it work? How do you establish that there was no wrongdoing?
Thank you, Honorable Chair and the members. If there is any material outflow from unauthorized, irregular, fruitless, and wasteful expenditure, if there is any finding that suggests material irregularity, material irregularity is then subjected to an investigation. If the result of an investigation, I'll give you an example what SIU does. The SIU will investigate through proclamation. The Auditor General will investigate through their business investigation unit. And if there is any alleged misconduct, we have our own risk management from the department, which then follows up and investigates. The investigation reports produces recommendations. So if there is any suspicion of criminal activity, that then gets referred to the relevant public body, be it public protector, be it SAPS, and if it's an issue of misconduct that requires our labor relations or disciplinary hearing, that gets carried out where we appoint an independent chairperson, say from another department or from another province within health or another department in another province, who is privy to disciplinary hearing matters. And then the recommendations are implemented. And there is a list of outcomes from such recommendations. If members are saying, here is a recommendation that was not followed up or carried out by the department, then indeed the management should then be responsible for responding to such. But if there is a material irregularity that then suggests investigations and is handled by a different public body, and the outcome of it has merits to say arrest, charge in court of law, freeze accounts, recover.
No, we understand that, CFO. The problem is, if we look at Resolution 180, the Auditor General says there was no such information that would lead to disciplinary processes. So you explaining a process, I'm asking, where is that information? Because even the Auditor General didn't get it. So will you be able to tomorrow send it to us, showing the investigation on each of these unauthorized and irregular expenditure, and on what basis was each then decided that no, nothing is wrong, we're not going to discipline? Because the Auditor General, if you had that and you gave it to the Auditor General, there wouldn't have been this question on your audit. The Auditor General says there's not appropriate evidence. So it seems that you are not following such a process, and whatever you explained regarding this magic new thing of testing doesn't carry water. Thank you, Chair.
All right. Just a quick word on the problems with determination testing is you're looking at going to matters from August 2023 to January 2024. Now, I happen to be part of, for my numerous sins, I'm also the chair of discipline in our province for our party. And I know that if you go and investigate a matter that's 18 months old, half of the evidence has disappeared. The witnesses are not interested. You've got to act on things now, immediately. Honourable Naya, please carry on.
Thank you, Chairperson. I just want to say, we received responses to the resolutions. We've received a report 20th January, 24th January, and the one that you were reading through this morning was dated 31st January. So that appears to be an outdated report. I'm not sure what has changed since then. Very concerning is the way your reporting has come through this morning. And even looking at this latest one that you read through, it's not detailed. It doesn't give you proper responses, and members have spoken to that. Now, I used to be an educator many, many years ago, and when students didn't have answers, they simply filled the lines in. If we gave them 10 marks, they would write something, paragraph, but you would probably give them 1 mark for it. And that's exactly what you've done here. You've given us generic answers, responses, which is very disrespectful to this committee. Absolutely disrespectful. We are taking our time here, and on behalf of communities, we are looking for genuine responses, and you're not giving us those genuine responses. But nevertheless, we move on. I want to touch on Resolution 173, the medical legal claims. Now, the department reported 3.98 billion in medical legal claims. What specific measures have been taken to reduce the financial burden of these claims on the department? And given that no claims were successfully defended in 2023-24, what challenges, just explain to us, what are the challenges that the department is facing in regard to contesting these claims? How much was settled? And what is the current contingent liability in regard to these medical claims? And then just to a final question regarding the claims. I understand there are legislative process interventions proposed by National Treasury. I think that was back in 2017. What have you done as a department to expedite these reforms? Have you made contact? Have you tried everything in your power to speed things up, these interventions? Thank you.
Thank you, Honorable Member. I will respond on the matter of measures that have been done to reduce the claim, to reduce the medical legal litigations. As CFO will respond on the current contingent liability. I just missed a few words on the last one.
With regards to the legislative interventions regarding medical legal claims, what have you done to expedite these interventions?
Okay. Thank you. In terms of reducing the medical legal claims, the larger bulk of our medical legal claims are around maternal and child care, whereby there would be adverse events which happens either during labor, post-delivery. So we have implemented a number of interventions to improve the quality of care in our labor wards, in maternity, and in our neonatal units. Chief amongst those is to ensure that we have appropriately skilled personnel that look after women who are pregnant and in labor, as well as in neonatal care. We also have specialists that go to our facilities and visit our facilities to ensure that the quality of care is improved. We have identified that some of the adverse events happened because of the high congestions in some of our hospitals that have got high number of deliveries. In that regard, we have established what we call on-site midwifery obstetric units, where we separate the low-risk women from those that are high risk, so that the specialized staff can look after high-risk women. But over and above that, what we have done is to establish what we have called the rehabilitation centers, which we call centers of excellence for rehabilitation for children with cerebral palsy and other disabilities. Our legal teams are working on what we call public health defense, whereby if there is a claim on any child, we then offer to actually provide the service, because some of the claim is around future medical expenses. So what we have done is to establish these centers of excellence in Grace Hospital, in Victoria Mcenge Hospital, in Gwelezane, and we have a specialized unit in Durban Children's Hospital, where instead of giving the whole claim or amount to the caregiver or the parent, we then issue the caregiver with a certificate with which this person will access the services so that we are able to provide continuous and lifetime care for the child with a cerebral palsy. There has been instances of where we've actually been successful in reducing the cost of the litigation just by offering those services. We've even in instances where we have considered liability, we've been able to negotiate to say, if the cost of ongoing rehabilitative care was going to be around 30 million, we will provide that care. And that has brought down the cost of medical legal litigation. We also have cases that have been dismissed. We have a case of about 6 million that has been dismissed, and we have saved that 6 million. We have settled on liability matter. There were 2 matters totaling 36 million, which we successfully settled with a 20% savings on the quantum of summons, and we realized a savings of 7.2 million. Those are some of the...
I just want to stop you there, HOD. You've explained in quite detail, but for the sake of time, I just need you to be very brief and answer to the point. The main answer I'm looking for is, what is the challenge in contesting these claims? What is the challenge?
Contesting the claim.
Yes, because the numbers that you've mentioned are very small in comparison to the 3.98 billion in medical legal claims. So I just want to know, what is the department's challenge in contesting these claims? Why?
Maybe the challenge is some of these claims are historical. They date back more than 20 years and so on and so on. Now, when you then have to look at the care that was provided then, some of the information may be missing. Then that might be the challenge, because say the child is now 21 years. 21 years ago.
So basically you're saying that the challenge is the inefficiency of the department in its record keeping over the years. But I see that you've introduced the e-health system. So before you answer with regards to the the current contingent liability, I just also want to ask, in terms of the e-health system, what are the challenges you're experiencing with it, and how is it working? When can we see the full implementation across all facilities? Because it seems as though that is where the major problem is when it comes to your record keeping. And obviously, if you implement this across all facilities, you're going to be in a better position to defend claims. I think that you can answer those questions.
Okay, thank you. We have started implementing e-health system in 42 of our hospitals. We started with hospitals that have high volume of files, regional hospital like your Prince Msheni, your Matateni, and Pixley Aseme, and others. We have rolled it out to those 42 facilities. We have bought the equipment, particularly in terms of hardware, your equipment, your scanners. We have actually trained the staff. We also have appointed what we call scanners, because before you have a fully digitized system, you have to
Here
scan
again,
the records.
actually, my apologies. I don't mean to be rude, but I just need you to answer what is the challenge that you're experiencing with it?
Okay,
and
the
what's
challenge
the timeline to fully rolling it out?
The challenge is, as much as we've implemented the e-health, there's challenges with connectivity. In that regard, we have engaged the services of a service provider to improve the fiber in order so that we could have both local area network and wide area network connectivity.
When can we anticipate a full rollout or an increase? What are your timelines looking at like?
I must say that will depend on our financial status, because there is high cost attached to rolling out a fully fledged ICT system. So whilst we are focusing on those hospitals, we will be dependent on the budget availability for a full rollout.
All right, thank you for that. But it would be nice if your department could forward to Scopa and plan some sort of estimation and, you know, what it will cost and so on, so that we can have an idea as well. If you could answer the questions relating to the current contingency liability and how much was settled.
Thank you, through you, Chair. On the issue of contingent liabilities, what we have prepared here that flows from uncertainty relating to future outcome of litigation, Resolution 173, how we arrive at a figure. We look at the number of cases, we look at the history and the level or degree of success from the history, and then we provide an estimated figure based on claims versus eventual settlement. Claims on record, and claims have different stages. First, you look at the letter of demand, and then the matter progresses to, say, a roundtable stage, negotiations, discussions, disputes, and it's referred to courts. Then eventually there's an award. Thanks. The schedule of matters during 2023 and 2024, amount claims in summons 89 million, settlement paid to plaintiff 31 million.
All right. With regards to the legislative interventions, I think you can just write to us and give us an update of what you have done. Just for the sake of time, I'll move along. Under Resolution 176, I agree with all of my colleagues that have spoken with regards to the determination testing process. It simply seems ludicrous that this process has not found any fraudulent activity, and that for us is very concerning. Irregular expenditure of 3 billion was incurred due to continued use of expired contracts. What is the progress in place in replacing these contracts, and why has this process taken so long? What disciplinary actions have been taken against officials responsible for failing to replace expired contracts? And then also under this resolution, you've spoken about condonation and you've explained it's a long process, but surely there's got to be some timelines, some feedback as to where you are in the process. This is a cumulative irregular expenditure of 21.67 billion. So please give us some specifics in terms of timelines and where you are. Thank you.
Thanks, through you, Honorable Chair. I will start with the unauthorized expenditure, how it comes about. If you continue to incur expenditure after the contracts have expired, and in most instances...
So this is not, sorry to interrupt, not unauthorized. This is irregular relating to the contract.
Okay, thank you. there are 289 contracts that needed to be replaced. And these contracts are usually huge in nature. I'll give you an example, a catering contract that is currently in court. So when the catering contract has expired, we still have to provide food and nutrition to our patients. So once it has expired, every cent that is spent on it then gets classified here as irregular because the service provider is not appointed through the regular process. Instead of replacing or appointing a new one, there's still a dispute and the court processes take long, but we cannot stop providing the service.
So how can we resolve this problem? What is the solution to this?
We cannot anticipate that the bidders will take us to court or will dispute the recommended bidder and we have to go for hearing. If you go to the previous year, for example, the chairperson of the bid appeals committee was not available. There was a vacancy there for such a long time. So all hearings had to stop and wait for the appointment of the new members for this to carry on. So we could not stop service.
No, sorry, Chair, let me interrupt. The member is not truthful.
Honorable Dirks.
Sorry, it's not truthful. If you award a contract to another company, the contract comes to an end and you appoint another company and the current existing company takes you to court, there is a way of circumvent it. You can stop contracting to that company in order to stop the irregular incurring of expenses. You can call when the company takes you to court, you can call for quotations. Call for quotations in the interim. So then you have now followed another process where you have called quotations. That company can then go to court, but it's not going to continue supplying, and that will stop companies from run to court because they know court processes drag out. Because while the court process drags out, you incur irregular expenditure. You must call in a situation like that to call for quotations. In the interim, the short-term solution while that court case goes ahead, and then you don't incur the irregular expenditure. Officials must start thinking in the departments outside the box.
Chair, I'm responding, Honorable Chair and members, I'm responding to the best of my knowledge. So if I am not truthful, let it be so that I'm not going to continue to respond because I didn't come here to tell a lie.
Listen,
that's
sorry,
one,
okay.
I don't feel protected.
Okay.
Chair.
Mr. Vilakazi. No, I'm the chair of the meeting. Hang on a second. Mr. Vilakazi, you losing your temper is not going to help anyone. Please understand you've been called here to Scopa to answer questions. All right?
May I proceed?
The member, sorry, Honourable, the member made a statement. Nobody's saying we agree with that statement or disagree with that statement, but he made a statement. He has parliamentary privilege to make a statement. You should be experienced enough to understand that that's a statement from a member and move on. So please, can we get back to Honourable Naya's questions? Let's answer the questions. Thank you.
Thank you, Chair. And just to add, CFO, if there are any questions that you're unable to answer at this time, you're most welcome to say that you will supply us with the information in writing later. So just to follow up now with regards to condemnation, from what you've been saying, it's as though you're validating a lot of the irregular expenditure and explaining how they occurred. Are you expectant of the bulk of this being condoned? And just explain where we are in the timeline towards condemnation. Thanks.
We have engaged Treasury since the beginning of times, and for condonation to happen, supporting documents are required. And some of the supporting documents, as you could see, that some of this irregular expenditure dates back to 2010 and beyond, are not easy to retrieve, reconstruct, or available. And for this to be successfully condoned, you need to first establish what had happened. And you need to also determine if there was any act of misconduct or material irregularity, which then requires further reporting and recovery if that is necessary. So it's very difficult to put time frames on the whole figure, but we are making progress towards that determination process. It does cost money and resources in terms of time.
Thank you. On the contrary, I think it's very important that you put timelines and you give yourself deadlines as a department in order to act. Otherwise, it just goes on and on and on for years and nothing is resolved. We cannot push accountability to the future. It must be now. So that's just my comment with regards to timelines and deadlines. Supply Chain Management Resolution 179.
Sorry, Honourable Mayor, can I just ask you to be mindful of time? We've got about 25 minutes left and there are still other members. I'm not trying to cut you down. If you've got reports and stuff, we can carry on, but if you can.
Can I take about 5 minutes more?
That should be fine, thank you. If we have to go over time, that's fine. I want to get the questions in, thank you.
And I think what will help us along is if the department as well, just answer and just get straight to the point. The AG found cases where officials fail to disclose private business interests. Has any disciplinary action been taken against these individuals and what were the outcomes?
Thank you, Chair. There were these staff members that were doing business respect. There were 8, and the investigations were done. And out of those 8, 1 resigned in the middle of the investigations. 2 were given sanctions, and 3 are still being under investigation. Thank you.
What sanctions were imposed?
We don't have the information right now. Honourable Member will provide that information. Thanks.
All right. Chair, I'm just 1 or 2 more questions. In terms of petrol card abuse, the department is investigating abuse of petrol cards. How many cases have been confirmed and how much money has been lost due to these fraudulent claims? That's 1. The other one is in terms of unauthorized remunerative work outside of public service. Some officials were found to be illegally running businesses while employed by the department. Have any officials been dismissed or prosecuted for this violation? And my last question, payroll and ghost employees. Have you as a department conducted a forensic audit of your payroll system to identify potential ghost employees? Thanks, Chair.
Thank you, Honourable Member. We will provide the details on all the investigations that have been done for staff doing business with the state and on petrol card. In terms of ghost employees, we have done an audit, or we've done a staff audit recently. It was done from both sides, from the HR side and from our internal control unit. We do have a report on the staff audit that was conducted, I think, late last year. We will provide that report. Thanks.
Thank you, HOD. And just finally, Chair, I think that department needs to be mindful of that going forward, when your reports come to us, this is the kind of information we are looking for. And those are the kind of reports you need to give us so that we can speak to those statistics that you provide to us. Thank you so much for answering.
Thank you, Honourable Naya. Let's move now on to Honourable Mkhize.
Thank you very much, Chairperson. I have a lot to ask, but I will just be brief. In this case, it will be just a follow-up from the last Honourable Speaker with regards to the officials that were or doing business with the department. Some happen not to have disclosed this. And my direct question will be, through you, Chair, to the CFO. Was or is the CFO a director of ISIGU, which we believe is the company that is doing business with the departments? If so, was this declared? That's number one question, Chair.
Thank you. I'm not a director of ISIGU. I was a director in a number of companies. Some do business, some I don't know if they do business or not, because I was in business for the past 30 years before joining Department of Health. And I've resigned in all companies. There's only two which don't do business. It's an NPC, Nkoko Foundation, which buys shoes and bags for poor kids. And then there's Advidata Trading, which is a dormant company. Those are the only two companies that I'm still a director in, and I don't do business with any government. I don't even have a CSD number.
Chairperson, once again, through you, is the CFO have any interest of ever been a director in any of the companies that are doing business currently with the department?
The second question.
To be clear, Honourable Mkhize is asking you, of the companies currently doing business with Department of Health, have you ever been a director historically of any of those companies? Not currently, but historically.
Yes, I've been a director historically with a number of companies, like I said before, that are doing business with Department of Health. I'll mention quite a few. If you go to your ITC check, you realize that I've been a director in SOE, audit firms, international audit firms, local firms based in South Africa, as well as special purpose vehicles that have done a lot of work in public sector, including Department of Health, before I joined Health and during my tenure at Health.
Chair, my third question will be, I'm not expecting an answer though right now. If that has happened, and the very same companies or companies still doing business with the department, we all know how that works. We all know how that works. Because of the interest vested, if it's active or inactive, but the interest is still there. In the very same department, that has collapsed, that is collapsing every day. The very same department that is unable to provide medical services in KwaZulu-Natal. The very same department that is unable to pay for water and lights currently as we are seated here. If not, there are offices where they are working. Because every day they are reminded by the very same municipality here that is useless, reminding them of paying their bills. Daily, as they are seated here, they are reminded to pay their electricity bills in Grace Hospital and many more. Lastly, why do you have billions of rands paid for medical claims? If all is going well. If everybody, they're getting their bonuses as they've performed very well. If everybody is getting bonuses because they are rendering the services that as government of KwaZulu-Natal is responsible for. Thank you, Chair.
Thank you. I think a good question from you would have been, and I'll ask it, CFO, have you received any financial reward in your current position from any of the companies that you were previously a director of that currently do business with the Department of Health? Can you go on record? No. Would you be prepared to submit to a lifestyle audit to prove that? Would you be prepared to submit to a lifestyle audit to prove that?
Yes.
Okay. There's an answer on record. You can take that further on in the case. Yes. Do you have a follow-up?
Chair, one part of my question that is not answered. Direct to the CFO through you, Chair. Were all these companies declared? All of them.
Thanks through you, Honorable Chair and honorable members. If you go through CIPC again, the entity was declared Mkoko Foundation non-profit company, which was registered.
Chairperson, Chair, can I have my question answered direct? Because I've answered a specific question and I expect a specific answer. Okay. Having me to go to CIPC, that's not my job. I know what I'm asking. This is what I'm here for on behalf of the people.
Let me assist you, Honourable McKees. Can you just please state the question again clearly? I was distracted for a second. Please state the question clearly. I'll make sure you get an answer. Okay, CFO, here comes the question again, clearly. Let's all listen. Honourable.
Again, Chairperson, was all those companies declared here by the CFO?
CFO, so when you began your tenure as CFO, did you declare to the department that I used to be the director of all these companies? Yes or no?
Yes, it's all in my CV, and I also gave them the ITC report that pulls out everywhere I've been, which year I joined, which year I resigned. And the two companies I mentioned, Advidata, sole director, registered in 2001. They said it has a CSD number, and I removed it from CSD. It's never done business with government. Mkoko Foundation, NPC.
So let the man.
Two companies where I'm a director. and they've never done business with government.
All right. Honourable Nkiza, I don't know who's speaking, Honourable Nkiza or Honourable Dirks.
Chair.
Okay, Honourable Dirks.
Chair, we're not asking if the companies was on his CV. We're asking when he was the CFO here and these companies was received work, was doing work here, that he declare that this company that doing work now with the department, I was a director of that company, that he declared it in the department, because there's an obligation of officials to do the declaration here in government, not on their CVs.
Okay, so let's just be clear here. The CFO has said, and members, it's up to us to now, you know, when you ask a question in a forum like this, you get an answer. It's up to us to test it. Okay, so the CFO's said on record, I'm not commenting on the veracity of what he's saying. Let me just sum up here. He said on record that he is no longer a director of any of those companies while he's been CFO. That's on the record. He said on record that he has not received any financial reward from any of those companies whilst he's been CFO. He said on record that he's prepared to submit to a lifestyle audit to prove that. Okay, and he said on record, I listened very closely to the answer, that he put all the previous companies on his CV and that he supplied a CRPC document to the department. For me, that's a declaration that he was director of all these companies. I don't know if there's a formal declaration. So let me just finish, please. Honourable Dirks, come on, man. I know you and me, we're quick to the punch. So I want to ask you, what more do you require from the CFO?
What I require, Chair, from the
Yes, please tell us what you are asking for.
When you apply for a job and you put it on your CV, doesn't mean you're going to get that job. You put this company as the director of these companies here, you put it on your CV, well and good, you get the job. But when you have been employed, you have an obligation, a legal obligation. There's a form that you fill in. There's a form that you fill in to say that I was a director of these companies and they are doing work with the department, and especially if that department gets work in the department. Especially if that company bids for work in the department, you have an obligation to inform the department that I used to be a director. You can't say it was on my CV. That doesn't hold water. That was on your CV. You must fill in the form and you must do the declaration. All senior managers must declare. Thank you.
Honourable Clerk, Dirks. Kabo's just showed me, and he can send this to you for your assurance. And as I say, you know, I'm also a person with a legal background, and I do a lot of this cross-examination stuff. So you ask a question to get something on record, and then you test it. For instance, in the Marcus Jooste matter, the Steinhoff matter, when I was in Scopa then, I asked him two questions, which led to South African Reserve Bank making their moves. Did you notify anybody of the crash that was about to happen? And did you take any short positions? And he answered no to both those questions. South African Reserve Bank then went and tested that, and that was what sunk him. So you've asked questions, you've got an answer, you can go test them. I just want to let you know, and I'll ask Kabo to send this to you, to all the members. I have a report here from PSC, Public Service Commission, that say that this is all the directorship members, right? All of them they've got a 100% ratio of disclosure of everything according to the Public Service Commission. So we can test this further, but can we move on from this point? I'll get this report sent to you. So that would include the CFO. So according to the PSC, the man is disclosed. Okay, but of course you can still test it. Yeah, absolutely. Absolutely, that's the whole idea. And I just want to compliment the committee today. We are now asking questions. This is good. This is exactly what Scopa is supposed to be doing. Thank you not fighting amongst ourselves, directing the questions there. Right, can we move on to Honourable Mbata on the platform? On the virtual platform, Honourable Mbata, you've been very patient. Do you have your questions?
Hey. Thanks, Chair. I've been patient, and I don't know whether I'm still audible, but
yes, you are.
I thank you very much, Honourable Chair. There's a lot, but because of time, I have so many questions, but because of time, I remember you said we don't have enough time. But I just want to ask two things, but before asking them, I just want to make this comment to say, Department of Health is one of the biggest departments in this province, and it is expected that the Department of Health must do things properly and in order. You know, firstly, the first thing was that we had a problem with the PowerPoint and all that. You know, you ask yourself, but the department is big. What is happening? But having said that, Chair, I just want to check two things. Firstly, is the issue of the medical legal litigation vis-a-vis e-health system. Now, to the acting HOD, to the hospitals or to the institutions where you've implemented the e-health system, have you implemented fully or still in phases before going to the medical legal litigation? That's the first question. Chair?
Yes, Honourable Mbata, is that your question?
Yeah, it's my first question to say,
okay.
The e-health system, has it been in those facilities that they are saying they've implemented the e-health system?
All right.
Is it fully implemented? Yeah.
Yeah, okay. Acting HOD, do you want to respond, please?
Thank you, Honourable Member. The implementation is in various phases. Reason being is that there are a number of modules that the system uses. It's about 32 to 37 modules. Part of those modules are those that are supporting modules for clinical care of patients, and like your pharmacy, your laboratory support modules. So what we have done, we've started implementing the modules that are starting with patient registration, checking of vital signs and clinical management, and then inpatient management. So what we are working on now is to end-to-end connection for the rest of the modules.
Okay, thanks, Acting HOD. I needed an answer whether it's fully functional or not. So if it's not fully functional, so now the medical legal litigation falls off because you still don't have a system that is fully operating. But the second question on the issue of the e-health system, how long is going to take for these facilities to now experience a fully functioning e-health system? If you can make a time frame, if you are not sure, probably you still want to do your calculations, it's fine. But I just want to get an idea, because you know, when I was reading your resolution 173, you can tell that the medical legal litigations are caused by the fact that there is no system in place in issues of, you know, if the card is lost and all those kind of things. So now there is a problem. So my what I want to understand on this issue is how long would it take in those facilities that you've identified? How long would it take for the Department of Health to have these systems, this system work fully?
Thank you, Honourable Member. We will provide that response with the time frames, because also it's dependent on the scanning of files. We are busy scanning files because for it to be fully functional, the file of the patient must be fully digitized. So we are retrospectively scanning files through the system. Once every patient's file is digitized, then the whole system becomes fully digitized. But we'll provide that information because it will depend also on the volume of patients, the number of files for each of the health facilities. But we'll provide the information, Honorable Member. Thanks.
And then, if I may ask, when are you going to provide that information?
That information can be provided as soon as I don't know whether we'll wait for the report from the author, but in the next Scopa we can provide that information.
Thanks, Honorable Chair. I still have other questions, but because of time, some of the questions actually they've been covered by honorable members. Thanks a lot, Chair.
Thanks, Oliver. So I'm informed by the committee assistants that we would normally ask all the departments after this round of scope hearings to report back to us by 30 June. I'm not sure I'm happy with that, but we will discuss that amongst ourselves. All right, Honourable Wata, are you done? Okay.
Yes, yes, Chair, I'm done.
Thank you, Honourable. Right, so my questions quickly. I'm sitting here looking at the SIU spreadsheet. The SIU report to us as well. And they've got a spreadsheet of a huge amount of health officials that have contravened Section 45 of the PFMA. Now, Section 45 constrains officials to avoid financial misconduct, which is irregular expenditure, etc., etc. To be specific, it's requires Section 45 of the PFMA requires public sector officials to take steps to prevent financial misconduct. This includes unauthorized, irregular, fruitless, and wasteful expenditure. What we've been talking about today. You reported in your response to us that you're looking at 29 cases. I've got 43 here where I've got no outcome. And I've literally got chapter and verse. I've got the person's name, the ID number, the reference number, and all that sort of thing, okay? So I'm going to be, with the permission of the committee, I'm going to be sending that to you and asking you for a detailed response on every single one of those, okay? Simply, we don't have time to go. It would be nice to go through them all, but I don't want to do that today. Then I've got criminal matters. There's one criminal matter, and I will go into this. It relates to medical claims, and I'm actually wanting to test whether you actually even know about this matter. Right, relates to medical claims that, let's just check something here quickly. It was referred by SIU in August last year, August 24. Okay. The referral number is DHKR 74. All right. It relates to medical claims. There are 3 individuals, and it relates to 16 million rand. And the referral is a result of a contravention of 17 subsection 2 of the National Health Act. Are you familiar with this matter? I'm trying to work out why there's no outcome. The other few outcomes there is we're waiting for the DPCI, waiting for DPCI, waiting for public prosecutor. But there's this one for, must I mention some names? Maybe that'll help. Janine Sanders, Christian Trotsky, Brendaman and Associates, and Bhavna Balwanth. How is it that you don't know about a matter of yours worth 16 million rand? Yeah, how do you not know? You're the accounting officer. There are only four matters that the SIU has investigated and said need to go to our courts. Only four. I'm not asking 44 or 404. Four. And you're not aware of one of them that's worth 16 million.
Noted, Chair. I will meet with the head of DIS because I've just started in February. So I'm still meeting with the different departments.
CFO, are you aware of this one? Do you know what I'm talking about? Did you also start in January?
No, I started in September 2022.
Yeah, so?
That's how I have these matters. But usually they go through our corporate services and legal services.
Yeah. You know, that really concerns me that is anyone here aware of this matter? Can I put it to you, that's half your problem. Hey, if I was involved in the department and there was a 16 million rand matter, if you ask me about it, I'll tell you at least, yes, I know what you're talking about. Let me get the file. But not like, Bible. I know nothing. Angas. It can't be right, folks. It cannot be right. You need to know this stuff. You need to be on the tips of your toes. Then, all right, I think that's it. So, look, my bugbear with you today, there's obviously lots of issues, but is that you're not, I don't believe, you know, you must understand, when you're not dealing with consequence management vigorously, and you know exactly what's going on all the time, the people out there know that. Okay? And I'm speaking once again, as I said earlier, as the chair of discipline in my organization. Okay? If you asked me what happened in this matter, I promise you I can tell you. And people in the province know that. And therefore, they more or less toe the line. When we have events, we have a 98% attendance. Because the guys know, who Brauta said, he'll come after you. And if you ask him about this, he'll know. And I just want to challenge you and I want to encourage you, please. I'm going to try and get you a format, which I think could be very helpful to you, that you can report these matters. And when people out there see that you have got your finger on the pulse of these disciplinary matters, they will think again whether that. But it sounds to me like you commit an offense in health and maybe 2 years' time it becomes an issue. That's not right. People need to know soon. They need to feel the pain soon. And I'm sorry you have to feel the pain today on their behalf. But when this sort of reporting happens, this is what happens. Okay, so that's me from the Scopa point of view. I know we're running a bit over time, but I'm not too worried about that. The day is long. We don't have transport. We've just got agriculture.
Chair, may I come in?
Yes, who is that?
It's Honorable Mbata.
Yes, Honorable Mbata.
Yeah.
Very briefly, because I was about to go to the portfolio committee members now, Honorable Mbata, but very briefly, yeah, go for it.
Yeah, I'm going to be brief, Chair. I was about to say something to what you've just said. I don't think it's acceptable that the biggest department, one of the biggest department in the province, when you ask them about issues within the department, and then there's no one that has the knowledge of it. It's not acceptable, Chair. It's totally not acceptable. It shows the incompetency within the department. And you know, how do you see that the department is incompetent? You see it by the things that are happening in our hospitals. It's not acceptable, Chair. Thanks.
Thank you, Honorable Mbata. Right. Any members of the portfolio committee, you've been very patient. I don't know if you have any questions that you'd like to answer, like to ask. As I say, please, Scopa-related questions. Honorable De Boer? Ma'am? Any questions? No? Yes, you have a question. Honorable member, please, you have the floor.
Thanks, Honorable Chair. I can see that there is a struggle for salaries in the department. There is a challenge. You know, the money is a big challenge. I have a few questions to our acting HOD. Is it true that there are employees within the Department of Health who are paid more than the level that is determined by the Department of Public Services and Admin? That is my first question. And maybe I must, yes, can I get an answer on that?
Sorry, do you want to ask all your questions one by one, or do you want to ask them all?
I would love to ask them one by one in case I have a follow-up.
Okay, HOD, there's the question. Are any people being paid more than they should be?
I'm not aware at the moment. I will investigate that. Thank you.
Okay, that can be part of your response. So we'll get a response on that. Okay, yeah, please continue.
I would love us to get that report. How many employees who are paid more than, because that money can contribute towards the department.
All right, so you'd like a study of what's pay scales people are on and how many are being paid more than they should be?
Absolutely,
okay.
Chairperson.
Please, HOD, you got that?
The
right,
question,
please carry on.
The question number 2, Honorable, I would love to ask if you have any employees who are not paying tax within the Department of Health.
Acting HOD, surely you know that answer. Surely you must say no.
Thank you, Chair. Paying tax is a statutory requirement and automatically happens. Tax is deducted through the PESAL system for any employee that is paid through the PESAL system, depending on the tax bracket or whether that employee qualifies for tax deduction. If there are any staff that would not be paying tax, then we would investigate that. But it happens automatically through the PESAL system. Thank you.
Thank you so much. My third question is, do you have any employees who are not South Africans, who do not have permits to work in South Africa within the Department of Health? I think, Honorable Chair, you'll see why I asked the first question, and then I follow up with this one. Because if, in case, maybe let me just give the Honorable HOD to answer. Do you have, HOD, any employees who are non-South Africans and who do not own the permits to work in South Africa within the Department of Health?
Honourable, I think what you're asking is, do you have any undocumented foreign nationals?
Thank you so much.
That's the
Thanks
correct
for helping
wording,
me.
yeah.
Thank you.
Undocumented foreign nationals working, because foreign nationals aren't a problem, they just need to be documented.
We don't have undocumented nationals working within the Department of Health because every foreign national who works through the department, there is a policy in terms of recruitment and appointment, and there is a time frame within which they can work within the Department of Health, and that follows a particular process for approval. And those documents, all the documents that they should have, are actually requested for and checked before they are employed.
The follow-up is, Honorable Chair, I would love to request from you, Honorable Chair, to do an investigation in terms of what our HOD is answering. The reason why, we have seen many foreign nationals. Remember, we are on the ground. We meet the people. So I would love this to be confirmed, that we do not have any, even the ones that were before, but after that they were, they ended up not having the papers to perform the duties within the Republic. Maybe I will just leave other questions for.
Okay, I think those are excellent questions. So just to summarize, any people being paid more than they should be paid, anybody not paying tax, and any undocumented foreign nationals. Can you please include that in the, we will write to you. Kabo, I'm sure you've got that. And we'd like your response from that. Just remember you're on record for 2 of those answers, eh? You said everybody pays tax and there's no undocumented foreign nationals. You said that in the meeting, so I hope you are correct. And obviously, we always like to get true answers here. We can always compare notes with the PSC on this, Public Service Commission. And maybe you should talk to them as well in getting your answers correct. Okay. Once again, HRD, we have no problem, and I'm sure the honourable member has no problem with a documented foreign national. Somebody who brings certain skills and that to the workplace. It's undocumented foreign nationals. Am I right? We've got a problem with anyway, the law of the land is that we've got no problem with foreigners working in our country if they're properly documented. So we can't even go there. But thank you, honourable member. Those are very good questions. Thanks a lot. Will you prepare your response in that regard?
Yes, Chair.
Okay, thank you very much. Are there any other members of the portfolio committee here? Yes, would you like to ask some questions?
Thank you, Chair. Again, greetings to the department. Most of my questions are more of a follow-up because they've been asked. In the issue of medical legal claims mitigation plan, the department opted to go for e-health, which is sitting now at a very low stage in its implementation. And as Honorable Moyo was asking, how far are you with the e-health? It's not something that looks like it's going to be ready in the near future or because of the workload that still needs to be done with it. Then the question is, what plans are being in place while we are waiting to finalize e-health, which might take time? And also, when choosing e-health, did you look at other plans and in terms of cost, how much is e-health going to cost the state against other plans that were there, if you did look at them?
Thank you, Honorable Chair. In terms of looking at costs for e-health was a system that was developed in-house using a few system developers that were employed by the department. And I think that initiative was aimed at saving cost rather than procuring a system outside of the department. Let's use staff within the department who are system developers. And in that way, I do believe that we saved quite a lot of money by using in-house staff. Even now, the support for the e-health system comes from staff that are employed by the department. Thank you.
To get clarity, how much does the department allocate towards e-health? You are looking at software that you have to buy computers, you have to buy scanners, you have to install fiber. For that, you have to get someone to do that. Even though it's an in-house managed system, but there is cost allocated to it.
Yes, Honorable Member, that is correct. For hardware and for connectivity, we have to buy those things. But in terms of developing the system, there is a budget that is allocated. I will provide the actual budget allocation in the report about that. We will provide the actual budget that is allocated for all those items. Thanks.
All right. My second question is around payables not being paid within 30 days. And then the department opted to implement the G77. And we all know from the last meetings that it has some teething problems. And can we get an indication of what are those teething problems and what's being done about them?
we are aware that there are teething problems.
Actually, can you make it a very quick answer?
Okay.
Remember, I'm not trying to cut across you, but these aren't really Scopa questions. But once you can attack in your portfolio committee, I'm just concerned that we've got agriculture waiting for us. So please give a very brief response to that.
The problems are around the movement of documents from facility to district to head office, for which we have processes in place. We have put up committees at various levels, and we have asked that the CEOs of hospitals, together with their finance managers, are part of the process so that they can ensure that the processes move faster, including ensuring that before documents move from a facility level, whether it's a hospital or city, they have complied with all the requirements in terms of completeness, in terms of accuracy, in terms of ensuring that they've got all the documentation that will be required at the next level. We are also meeting on a weekly basis with the CEOs and the district directors just to monitor the finalization of those transactions or orders. Thanks, Chair.
Thank you.
Okay. Sorry, before your hand went up, I had Honourable Kika.
Thank you, Chairperson. Chairperson, there are lots of things that we'll ask at our portfolio that arise out of this meeting. We've made notes of those. So thank you for the opportunity to allowing us to be here, and also for the insightful responses under oath, which we will interrogate. But the Honorable Naya asked an interesting question, and it was very pertinent, and the response to me was unclear, because we know things move, and they can move very quickly. So the presentation that was given to us was indeed dated the 20th of the first month, 2025. So I'm not going to ask one question at a time. I'll ask 2 or 3, and then you can choose which ones to respond to. So should not a more updated document have been provided to us? I mean, there are some things that don't change, but there are things that do change. So just about the document and the freshness of it. In terms of the medical legal claims, what the National Minister reported last year that the claims against the Department of Health in KwaZulu-Natal totaled an amount of around 29 billion rands. That was the total number of claims. Doesn't mean that that's what you're paying out and that's what you're dealing with. So in terms of that specific figure, I have no doubt that in an 11-month period, 9-month period, that figure had climbed by 9 billion rands. So between last November and now, what is that figure? And I'll give you a reason for concern. Last year, you had the entire nursing staff of the NICU at Albert Lutuli. NICU is a neonatal intensive care unit where they deal with the brand new babies. The entire staff walked out of the NICU, the nursing staff. They left 2 people in charge. And in the time of their protest, 2 babies died because of extubation. Just to give you an idea of how these things arise. There is a medical doctor sitting here, Chairperson, and he can tell you there was a child that was given what I call a lethal injection. Potassium chloride, it's what they use to stop the heart in the lethal injection. A child was given potassium chloride undiluted, died within minutes in that hospital. So these are the kinds of things that happen there, and then, we wonder what consequences there are for people who are directly involved in these kinds of walkouts. Nothing has happened to those nurses. Nothing. Not even a rap on their wrists for those things that happened at that time. So, Chairperson,
that's an operational issue.
Yes, Chairperson. So for me, the figure is on the medical legal claims, the total number of claims against the department, and the freshness of your document. Thank you.
We will provide a report on the total medical legal claims as well as investigate the issues of the death of the baby who was given lethal
Okay, let's just clarify. The medical legal claims, that's something that we're interested in Scopa, but the terribly, terribly sad death of the child is a portfolio committee matter. Certainly not that we don't care. I mean, it makes me go cold. I get very emotional. All right. Member, you had your hand up. This, I hope, will be the last question of the day because we really are in overtime now.
Thank you.
Member, please.
Thank you so much, Honorable.
Make it brief.
Chair, what I wanted to follow up is the e-health system. We know the impact of non-compliance, and the impact in terms of the outcomes when there are legal issues and so on. Is the e-health complying with the body related to it? Or that is my question. Is it compliance, the e-health system, or the company that is providing the service for the e-health? Are they compliance? Thank you.
I think the question is the company that you've asked to implement e-health, are they on track? Are they up to date where they should be? Are they complying? So if you could answer the question briefly and then we can be done.
Thank you, Chair. And thank you, Honorable Member. We don't have a company implementing e-health. The only company that is assisting us with improving connectivity, which is Telkom, who are installing fiber in our facilities. As I indicated, e-health was developed, is maintained and managed by our own departmental staff. Thanks.
All right, members, it's been a long session. We started at 9 o'clock and we are now just past 12:15, and we've still got another department and an entity to handle. So I'd like to thank you all for your attention, members, and your participation and the tough questions. I really do appreciate it. Colleagues from the department, thank you. I know you've been in the firing line. I just want to make something clear. We are defenders of the Public Finance Management Act, but we also don't want to see you here. We want you to do so well with the Auditor General that there is absolutely no reason to be here. So we encourage you to take on board what we've done today. To supply, Kabo will be in contact with all the information we want. If you ask it to our satisfaction, we may not have to call you again. And let's hope that you do so well this year with the AG that they don't recommend that we call you. So we encourage you, and we wish you all strength with the health of the good people of KZN. Thank you very much. With that, folks, the meeting is adjourned. Thank you. Members, Scopa, I think we'll take 10 minutes, 15 minutes. We'll start again at 12:30. Okay, so if you want to grab a coffee or comfort break, thank you very much. Sorry, members, we're just waiting for the document to be put up on the screen so that we can get going. I don't know. As soon as that is sorted out, can we get this sorted quickly, please? Well, okay. Yeah. In the meantime, let me just do the welcoming. I've welcomed all the members on my left. So welcome again to you. We are now going to be talking to the Agriculture Development Agency and ADA. And we don't have the MEC here, but I'd like to welcome all the officials from ADA. Thank you for joining us. This is obviously a follow-up to our meeting in October, and we're going to look at the responses you've given us today. I believe we are quorate for this meeting. Okay, we are quorate, and I would imagine the same apologies stand as this morning. All right. We'll now do an introduction. The members on my left have already introduced themselves. So let's start on my right. If you could just introduce yourselves quickly, and then we will proceed.
Thank you very much, Chair. My name is Zebusiso Dlamini, the Head of Department for the Department of Agriculture and Rural Development. Greetings to all honourable members.
Good afternoon, Chair, honourable members. Eckhard Habermann, the Acting CFO for the Department of Agriculture, Rural Development.
Good morning, Chair. Members, my name is Ntokozo Maflega, Deputy Chair for Agribusiness Development Agency. Thank you.
Good afternoon, Chair, honourable members. My name is Tule Tukumalo. I'm the Acting CEO of ADA. Thank you.
Good afternoon, honourable members. My name is Matobi Mkhize, CFO of ADA.
Good afternoon, Chair. My name is Jerry Mfusi. I'm the Acting CEO for KZN Farming Enterprise.
Good morning, Chair and honourable members. My name is Tabiso Selai. I'm heading the corporate services for ADA, which is the Agribusiness Development Agency. Thank you.
Good day, honourable members. My name is Andy Letupelem. I'm from the Office of the Auditor General. I'm the audit manager for both Agribusiness Development Agency and Department of Agriculture.
Okay, thank you very much. I've noticed that you've all got very soft voices, but we need to get you on record today. So please, when we do chat later, you can pull the microphone a bit closer to you, put it right at your mouth and speak up. Okay, you don't need to be nervous or scared. We just want to get through the business of the day. Are there any members on the online platform that weren't present this morning that would like to introduce themselves? Maybe those who were attending this but didn't attend the... Yes, please continue.
Sorry, Honourable Chair, I was just saying we are still here. I see you now. Honourable Mbata, thank you.
Yes. Now, I'm talking about perhaps new members from the Portfolio Committee. Are there any agricultural portfolio members? No. Next to, yes. Would you like to just introduce yourself there next to Honourable Mkhize? You are attending from the Portfolio Committee, I know.
Thank you, Chair. Good afternoon, everybody. My name is Lutunzama, a member of the committee, Lago Agriculture and Rural Development. Thank you.
Welcome to you. Thank you very much. Okay. Are we having any luck with this presentation? I don't understand what's so difficult about this. Can't we just put it on the screen? Must I email it to someone or? So what is the actual technical problem? Are we going to wait for this, or can we just start working from the document that we all agree on, and then members can follow that? Can we do that? Because I doubt members actually read what's on the screen because it's so far away. Members, the document that we're going to be going through is was sent out as per my instruction when we received it, but also you would have received it yesterday. It's on the Teams platform. I hear what you're saying, Kabul, but how long are we going to wait for this? Another hour? This is crazy, man. Seconds, okay. There's lots of seconds in an hour. The documents were sent yesterday. I think that really you guys need to speak to Kabul because I received them yesterday and the email to the whole Scopa committee. Let me just double check here. It went at 5:55 p.m. It was dear honorable members and colleagues. And I'm trying to see everybody who was on there. It sent out the link to the meeting and then also the documents. These legislature emails, you can't see who they actually went to, but it was at 5:55 yesterday. And then also, and the health ones were sent at 8:07 a.m. yesterday. This is on the KZN legislature emails. But we can give it to you again now. See on these ledge emails who it went to.
Chair, just some clarity. Are we looking for a recent updated ADA report? Because we received DARD and health late yesterday. Oh, okay. Thanks.
Is this the new amended report? Because the one I've got doesn't have that logo on top. The department's lettered, I don't have that one. Sure. Okay, you know what, folks? We've been wasted far too much time. This is very frustrating. Please, next time you appear, let's be professional. All right, let's get going. Members, we're going to start now. We've done the introductions. I don't know, can somebody please reduce their volume there? It's on your laptop. That HP one. There you go, got it. Who's going to be doing the presentation?
I will, Honorable Chair, be doing the presentation.
Sorry?
I will be doing the presentation, Honorable.
Yeah, please speak up. If you're going to make the presentation, that voice is not going to work. I need you to really get in there and speak up, please. We need to hear you. Okay.
Chairperson.
Thank you.
Okay.
Yes.
Yeah, sorry to interrupt you, Chairperson. Chairperson, all the presentation, all the departments that appeared before us this morning, there's no MECs. Are the MECs in cabinet or what?
I have no idea. This is an entity, but you're right. The MEC should be here.
The only MEC that comes, I see, is from Public Works, always there, and sometimes education.
Yes, so far you're right. Actually, and Reverend Zondi was here with Etia. Yes, she was. Okay, have we received an apology from? Pardon? The MEC of Agriculture. Okay, we don't have an apology for that. Yes, Honourable Twala.
Thanks, Chair. I was also asking my colleagues, but usually I don't see MECs attending.
Yeah.
But I don't think we should let it just slide as by the way issue. I think you should take it a step further, Chair, because MECs, they must come and account here. So if they are not here to account, and they are the ones that are heading the departments as well. So what course of action this committee must take then to ensure that the MECs come and adhere to these meetings. There is something that must be done. It's either you write to the speaker to appraise the speaker that we are having this challenge of members of the executive not attending Scopa hearings. Thanks.
Sure. I fully agree with you. MECs need to respect our hearings, 100%. The MEC for health did have a legitimate reason. They submitted an apology. Let's see if agriculture doesn't pitch. I think that's actually been the only ones who have not appeared so far. So I think we're on track. But yes, 100%, just like it was in Parliament. I remember in the NCOP, if we were looking at an annual performance plan, if either the minister or the DM was not there, we didn't continue, cancelled the meeting. You know, they need to be there 100%. The executive need to be there. Okay, so members here, we are now colleagues. Before you start your presentations, we all need to take the oath or the affirmation. So I hope you remember from October last year, this is not something just reserved for you, it's for everybody who appears in front of Scopa. So starting with the CFO here, no, you're not the CFO, sorry. Starting here, we're going to raise your right hand and say,
The GFC, the HOD sitting there next to you is like a part, he's sharing the meeting there with you. I thought maybe they'll move more this side here.
I really don't have a problem with it, Mr. Honourable Dirks. Okay, I'm just frustrated to get going here, members. Can we just stick to business? Thank you. Let's just get moving. All right, so we'll start here. You know the deal. If you want to do the oath, you raise your hand. You say, please, in either case, you raise your right hand. If you're doing the oath, I, in your name, hereby undertake to tell the truth, the whole truth, nothing but the truth, so help me God. If you prefer to just do the affirmation, you say, I, in your name, affirm that I will tell the truth and nothing but the truth. Okay, so let's start on this side, please, and get that done, then we can start the presentation. Thank you.
I, Zebusiso Dlamini, swear to tell the truth, nothing but the truth, so help me God.
I, Eckhart Habermann, swear to tell the truth and nothing but the truth, so help me God.
I, Ntokozo Maflega. I, Ntokozo Maflega. I affirm to tell the truth, nothing else, only the truth.
I, Pamela Tuletu Kumalo, swear to speak the truth, nothing else but the truth, and I will request the Lord to help me. Thank you.
I, Matobim Kzn, swear to tell the truth, nothing else but the truth, so help me God.
I, Kzn Scopa, swear to tell the truth and the only truth, so help me God.
I, Tabiso Selai, I swear and I will speak nothing else but the truth, so help me God.
I, Chupele Andile, swear to tell the truth, nothing but the truth. Thank you.
You started off very strong, but then you went soft. So it proves you all have nice, strong voices. Okay, let's start with the presentation. Acting CEO, take it away. I'm going to give you a total of 30 minutes to present. Please don't read what you've sent to us. So we still don't have this on the screen. Seems to have disappeared again now. But anyway, I don't want to wait any longer. I'm sure it will come. But can I ask you, simply because you seem to be working on a different document to us, I'm not sure, please just tell us where you are. So tell us we're talking about resolution number, da-da-da, our response is on page da-da-da, and there. So members can follow where you are and what you're doing, okay? Thank you, Acting CEO. Please go for it.
Thank you, Honorable Chair. We will start with a resolution 144/204, and this resolution talks to the vacancy position of the CEO, and I will request the Deputy Chair to talk through this resolution. Thank you, Chairperson.
Good morning once again, Chair, committee members. As the acting CEO has said about the resolution 114/2024, the matter of the CEO within the ND has prolonged for a quite long time. However, I must have give the confidence to this committee that now we are to an end to advertise the post of the CEO by the end of the first quarter. We assure the committee, it will have. But what have we done? What have we done to do that? It should be remembered that the year of 2022, 2023, and 2023, 2024, the entity didn't have a CEO. So by so doing, there were lots of things that has been done. And when we came as the new leaders of the entity on September 2024, it was one of the priority for us to make sure that the CEO is appointed. However, due to certain matters that were unresolved, we had to start on those matters to be resolved, then to make sure that we refine everything, of which we've already refined them. That's why we said now we've come to a resolution of saying by the end of the first quarter, we'll be having a CEO for our entity. Thank you.
Thank you, Deputy Chair. Now we are moving to Resolution 145/204. And the response to this resolution, which talks about the financial statements, is that we have embarked on a continuous assessment of the financial statements that includes doing interim financial statements on quarterly basis, and we have reviewed this in September, and some of the issues that were in the AFSs, they talk to conditional grants, disclosures, inadequate records, and in particular the prepayments, as well as incorrect classification of project expense and incomplete disclosure of irregular expenditure, and the bulk of misstatements were, however, challenging, but we have tackled them. Up to now, I can report that we have done 60% of those, and we are confident that they will be accepted because even our internal audit team has reviewed these and have also presented to our Audit and Risk Committee. And thank you. I'm moving on now to Resolution 146/24, where it digs deeper to one of the issues raised in the previous resolution, which is the prepayments. And in relation to this resolution, we talk about the prepayments to beneficiaries. The entity is working tirelessly to improve its controls relating to these prepayments. And these prepayments require that we have the proof of quotation by the suppliers, and also that the payments are closely monitored and are reconciled on a monthly basis. Furthermore, the entity as board has indicated that going forward, the direct funding, which has resulted to these prepayments to beneficiary, is going to be phased out, and this will be done through the internal SCM processes of the entity. To this effect, we will put in place a panel of service providers as well as participation on transversal contracts from National Treasury to shorten the procurement process. These are closely monitored as well during EXCO, and they are detailed on the EXCO minutes. They also appear on the AG improvement plan, and the AG improvement plan is also a standing agenda on the EXCO meetings. I'm moving on still on page 4, Resolution 147 of 2004, which talks to irregular expenditure and for prior years not condoned. And in response to this, we said we have done irregular expenditure, is in the process of internal investigation and to prepare possible condonations. The financial statements have, however, been updated with the irregular expenditure, as I've explained before, that they've been reviewed through the interim financial statements. And the internal investigation conducted by the appointed officials within the organization that forms the Loss Control Committee, and that one has been concluded, and we have prepared had a submission to the board to consider these condonations for further a submission to provincial treasury and further guidance or approval of the condonations and then activating it as recommended. Now on page 5, I'm moving on to resolution 148 of 24, where we are discussing the underspending on conditional grant, 34 million rand in 2022, which was 24.19 million rand. And our response to this one is that we are aware that CASP is 70% infrastructure, and these infrastructure projects takes longer to implement. And as of the end of November 2024, we had spent 24 million rand of the 34. The balance of 10 million will be fully spent in March, and we are also aware that CASP is the only main source of our funding for the current financial, which amounted to 60 million rand. Unfortunately, approval for CASP projects were late, and 50% of the CASP projects were approved in November, and infrastructure takes more than 6 months to implement, as we have to do the designs through the technical engineering team. And as of December 2024, 23 million has been spent, and the current year's budget mainly for inputs. The infrastructure is anticipated to be completed by March 2025. And there is an amount of 6.9 that has been spent on this 10 million for the current financial year. We've also developed a catch-up plan with the implementing team to expedite the implementation of this project, both the ones that we are talking about and the current projects we are implementing. I've moved on to page 6, and the resolution is resolution 149/2024, where we are talking about the receivables from exchange transaction and allowance for impairment. And our response to this resolution is that the correction has been made as in prior year been adjusted through in the interim financial statement, and we have been prepared for the period ending 30 September 2024. This has been reviewed by our internal audit. Further, AG has indicated that they will do assessment through the entity to preview in February. The error occurred as a result of the change in the policy of the previous years, and this error has been corrected. But while we were correcting the reinstatement, the extrapolation by AG and the whole population will be revisited and was revisited by us as well to prove for its correctness. And still on page 6, on resolution 150, where we are discussing the investigation report. And ADA's response in this resolution is that the overall amount that was just investigated amounted to 23.3 million, and there are findings in the report, and the other 23 million involves issues that were allegations, but during the investigation, the findings was that there is 175,911 that the beneficiary relates to the activities done by the beneficiary, and 1.436250 relates to the ADA official. And there were also findings that ADA official failed to ensure that proper and appropriate market-related costing was done in regard to the additional funding for the beneficiary. and they failed to seek guidance from the infrastructure unit in regard to the escalation rate of the project. And again, 3 ADA officials failed to ensure that proper protocols and approval processes were obtained from the council when a motivation was made for the beneficiary to be funded, and that could not be supported by minutes from the board. And recommendations is to take appropriate action against officials implicated for failure and to get approval for the council or board. The recommendations also included that we need to recover a sum of 52,965.28 rents, which is 50% of 245,891 from the beneficiary that could not be accounted for. And the second portion is the steps taken to implement the recommendations of the investigation, including disciplinary action and the sanction imposed, recovery losses, and opening of the criminal cases. A letter of demand has been written and to the beneficiary in an attempt to recover the 175,911.28 rents that the beneficiary transgressed on. And due to the nature and sensitivity and seriousness of the allegations, we have involved DART Labor Relations to assist us in the disciplinary proceedings. The outcome of the disciplinary will determine whether we pursue a criminal or civil litigation. The disciplinary proceedings will ensure that substantive evidence is collected for the purpose of opening a criminal case. Measures implemented to avoid the recurrence of these issues. We are reviewing the funding policy and delegations of authority. We are going to improve transparency in the project and financial processes. We will also review our project implementation processes, as stated earlier on, that we are moving away from direct funding and now we are using the internal processes, which is SCM, including the transversal contracts. And some of this project will be implemented through the internal processes to avoid inflating or escalating project cost. Honorable Chairperson, I end here with my report. Thank you very much.
Thank you very much. All right, I'm going to now hand over to members. We'll start with, let me keep my notes here, Honourable de Klerk. Yeah, sorry, let me just get my notes. Okay, de Klerk. No. Okay. Got Honourable Naya, yeah. Any questions there? Do you have any? I'll come to you. We do Scopa first. Okay. Thanks. Are any members, Honourable Bata, Honourable Biela, do you have any questions? No? Okay, not at this point. Right, Honourable de Klerk, go for it.
Chair, I think in the future I'm going to be quiet a little bit, see what comes. If I'm quiet. Entity, I have to start to say I'm extremely disappointed in the quality of your reporting. It seems to me that you try to say as little as possible. And I'll explain to you. Let's start with Resolution 145. This is a serious issue that the Auditor General raised. The financial statements submitted for auditing were not prepared in accordance with prescribed financial reporting framework. That's the bare basic. It's a shocking issue that a small entity like you cannot even comply with the bare basics of financial reporting. Then we as Scopa ask, and we expect detailed answers. And we ask for the turnaround strategies, exactly what it is, how does it work, and the effectiveness, and so on thereof. And what do we get? There is continuous assessment of financials. Really? What is that? It should happen anyway. With financial statements being prepared and reviewed on a quarterly basis. What is that? You tell me nothing. The first set was done for the period ending September 2024. Yes, it should. Where's the strategy? Where's your timelines? How are you going to deal with it to do at least the basic and have proper financials? I don't see it. The first assessment is indicated there was a few items that has not been adequately addressed. What items? What are we talking about? So please answer me. Why such answers? Explain to me in this answer, where do you tell us with particularity how you addressing a serious Auditor General problem that you do not comply with basics in your financials?
So,
Sorry, I didn't explain it. Maybe you remember last time, this is a back and forth between you and through me, obviously, but so he may ask you a question back and forth until he's finished, and then we move on to the next member. Okay.
Thank you, Honorable Chairperson. Honorable de Klerk, the entity was not doing a interim financial statement on quarterly basis, and it has started to do interim financial statements, and these interim financial statements are audited by the internal auditor within our employ, and the Audit and Risk Committee sits on quarterly basis, and these are presented also scrutinized by the Audit and Risk Committee. We did prepare an audit, an AG improvement plan, and the AG improvement plan as well is presented to the ARC. And the issues that we say we finalize them in the AG improvement plan are all audited and ratified by the internal auditor. And we have also engaged Provincial Treasury to assist us with the prepayments, and they will be involved with us. They are prepared to assist us. But in terms of us not complying with how to prepare the financial statements, we corrected all the errors that were discovered by AG, and all those errors have been proven, and we recorded even the previous we opened the previous closed financial statements to update those records, and the costing or calculation of the figures that needed to be corrected was verified by the internal auditor.
Yes, but why is it not in your report? Why must I ask you for this information? You had from last year to now months to answer this report in detail with particularity. Do you agree that this doesn't suffice? It should have been in your report. We go to the next resolution, 146. Here we're also dealing with a very serious issue. The Auditor General was unable to obtain sufficient appropriate audit evidence. Goodness gracious. That's a disclaimer if you don't have that. We're not dealing with education or one of those big entities or departments. So what do we want to know? That the Accounting Authority report to us by the 31st of January, that's 4 months that you had, on the outcome of the implementation of the turnaround strategy and the impact in improving. Answer, this is in relation to prepayments. So what? The transfer of payments to beneficiaries. Okay. The entity is working tirelessly to improve its controls. Please, ma'am. What are those tireless actions you're taking? Please explain to us, because this doesn't tell me nothing.
Thank you, Honorable Clerk. The prepayments relates to the direct payments that are done to the beneficiaries when projects are implemented. And when the beneficiaries then procure inputs as well as material to build the structures, the invoices and the quotations as are with the beneficiaries. And when then we record the payments in our books, those documents take long to come to us to record that this invoice relates and this quotation relates, where we are even able to pick up any over payments. So we have changed the system now, because we saw a gap there to say they take long to come. So we are saying they must bring the quotations first before we could even release the payment, and then we get the proof. But in terms of your concern that what have we done? We have looked, because this dates from 3 years, we have investigated all the years, and in the current financial year, we have recorded more than the previous years. We are still trying to get the documents, and we've identified those few projects, which I think there are 3, wherein the invoice, the vouchers are not coming. But most of the projects we have got the vouchers, and our internal auditor has verified that these vouchers are valid, and we've cleared them in our prepayment register. And we have as well appointed more staff to deal with this matter, and I've also explained that we've requested a Provincial Treasury to assist us with clearing this, and they said they will give us more staff, but their involvement is more in depth, because they will have the officials visiting the project before they could say the voucher that we get, we can record it as a payment.
Thank you. That in the report, ma'am? Is it a secret? You must be proud on the actions you take. Put it in the report. I would ask the chairman at the end that actually we demand a full and proper report from this entity. Then, if we look at 148, resolution 148, that is the material under expenditure. Now, we've been sitting for quite a while listening to departments and entities, and the one aspect that is clear from everybody is that there is a shortage of money. But this entity underspent material. It's a cardinal sin. But let's hear what is your answer. This relates to project infrastructure expenditure, and projects are taking longer to complete. Okay? So, why? As at the end of November 2024, 20 million and the 34 million has been spent. Yes? Why? How? The balance of 14 million will be fully spent by January 2025. Cash is the main source of funding, and the entire current year's budget is 60 million. Unfortunately, approvals of cash projects were received late. Now, all of this explains in some way, although a very short way, what is wrong. But I don't see how are you dealing with this? How are you going to deal with the fact that the project is taking longer? It can't be a fatalist view of, oh, that's why it is. So year in and year out, when we ask this in resolutions, the answer will be, it takes longer. Please understand my frustration. How are we going to assist you as an entity if this is the caliber of answers we get and we don't know exactly what's going on? So let's start with, why does it take longer? What have you done to make sure that it doesn't take so long, that we don't have a situation where year on year we were told it's going to take longer because of the process? How are we going to streamline this process? We have to bring it in line so that we don't materially underexpend. I'm waiting to hear.
Thank you, Honorable de Klerk. ADA is only funded through CASP, and CASP is a conditional grant from National. And National appropriate those funds in the same year that we are supposed to implement. And it's a process that we have already started for the next financial year. And there is a committee which is called NAP, National Assessing Panel, which sits to approve these projects, and they are very, very strict. They want all compliance. They visit the province, visit the projects, and that takes time then in terms of them approving the projects and projects coming to us.
Okay, I just want to quickly come in.
Yes.
Am I understanding you correctly? It doesn't matter what you do, because of the system, because of the procedure, the strict requirements, you will always underspend materially. Always. We must now accept, because of what you explain now, this will be a constant issue by the Auditor General, materially underspent, because of how the system works. Am I understanding it correct?
Honorable de Klerk, let me explain this because
good. It was not in the report, so please explain.
Let me explain this. If you've got something that is not in your position, but it's due to you to use it, and you've got someone on a certain position who is the one who's supposed to release that thing for you to use it, then you are living in a discretion of that person. Whether you like it or don't like it, you are in the mercy of that person. Now, this is the similar situation that ADA is facing with.
Now, I understand, sir. What I'm asking, I understand what you say. Not blaming you. I just want to if you agree with me, because of the system failure, because of what you explained, somebody else has to give you the money and has control and so on. This is a constant issue. This is going to be there until such time as the system in totality changes. Do you agree with me?
Yes, I agree.
Okay, that's all I want to know. Then my question is, have you ever taken steps, intergovernmental steps, or any steps whatsoever to try and alleviate this problem?
There were so many discussions made before, but if people, they've got their own policy and their own system, they are not willing to compromise their system to adopt your system. You'll always fall in a system of saying, let me wait their system to unfold first, then I'll get what they are giving to me. There were so many engagements, there were so many things. At other courts, it was proposed that even what if they can maybe have some offices around the province, so those people who stay in this province can visit those projects, and they couldn't agree. They want people to come up there in Pretoria to come in and check those projects. Now, it takes time because you'll find that according to us as ADA, maybe we've got 26 projects that needs to be funded. They need to visit one project and see everything, and then they satisfy themselves. Bearing in mind, there are 9 provinces in this country. How long will it take? It will take a long time. So it is the mere fact that we've engaged, we've tried, but it couldn't materialize. We are living on their mercy.
Understand.
Yes.
So unfortunately, ADA is geared to fail on that issue. It's geared to fail. You've tried your best, so we will have to take it now to a different level to try for them to see. And then just lastly, on the last resolution I've got, 150. That's the disciplinaries and all of that. Just want to check if this confirms with my document. No, it's a bit, the response is a bit more. Okay, the report is handed to the entity towards the end of Q3. When was it handed? When did you receive the report? What date? Because to say at the end of Q3 is so vague, it's embarrassing.
Okay, Honorable de Klerk, it will be remembered that when this investigation started, this board was not even there by then. This is the new board.
Yeah, no, sorry. I just want to know the date.
Okay.
Not.
Now, it was the report was brought to the MEC, and the MEC brought to us on the third quarter. So that's when we that was December. That's when we started to have a report, and we've looked at it. We are busy by all the means to trying to fast track and implement the resolutions of the report.
Yeah, the reason why I'm asking is simple. How long has it taken, this whole process?
Now, if I can understand, Honorable, which process for us?
The whole resolution that deals with the disciplinary and stuff, and we're talking about the reports and so on. How long?
Honorable de Klerk, the MEC brought the report on the second week of December.
Okay.
And in that period, when the board left, we started to action the report, but only to find that there is a limitation, that is, we cannot advertise to request for service providers to assist us. So we had to wait the whole of January and not action anything. But then we were busy reading the report and having angles on how we will approach it. Right now, we are at the level of starting with the report, as in fact implementing it, because the team has been appointed, the evidence leader is appointed, and the presiding officer is appointed.
Okay. No, that's wonderful. When will they be finished? Give me an estimation, please.
Well,
will it be 1 year, 2 years, 2 days?
I think these are based in terms of the Labour Relations Act.
Yes.
Yes, and the time we start to issue the letters to the official, that will be the time, and we have 90 days to complete everything, and we are planning that way. We are not planning to go on forever, because that will be outside the prescripts.
So when did they receive notices, the officials?
The officials haven't got the letters because we wanted to appoint the evidence.
No charges yet?
Yes, no charges sent. Charges will be sent starting from next week.
So when did the investigator start the investigation?
I'm not sure, sir. And because the investigation was done by the department and the report was received by the entity in December. Thank you, sir.
Now, that's my last question. Once again, you see the difficulty if there's no particularity, then we can't establish if it is going well with the investigations and so on. We just don't know. Thank you, Chair.
Honourable then Honourable Dirks, yeah.
Thank you so much, Chair. Indeed, as Honourable de Klerk has mentioned, there's not much we can ask if investigations are ongoing and you are unable to give us clarity in regards to that. But I want to ask...
Sorry, Honourable Nye, if I could just clarify. Investigations are complete. They've been sitting on the report for 2.5 months. That's the reality. They received it mid-December. It's now end of Feb. The ADA has been sitting on that report for 2.5 months, which is standard in terms of how departments like to slow things down. So maybe you should focus your questions on that.
So I just want to ask, given the delay in appointing a CEO, how has the agency managed strategic leadership and decision-making without a CEO?
Well, thank you very much, Honourable Member. I want to be honest with this committee, because I've taken the oath. I will be honest. When the the new members came in. It was September. Already we had an acting CEO, which was an outgoing CEO. By so then, there were so many processes that will need to be followed to empathize the members. I'm trying to say, by then members, they wouldn't try to touch anything before they've got an authenticity of saying that they've got the deeds and everything. Now, it took another 3 months for that one. But the only thing that happened was to appeal to the MEC to assist with an acting CEO, of which we have right now. But then again, once everything came back into order, that's when we started to have procuring everything, checking the levels of it, because even the entity itself, it needs to be washed somehow, somewhere, because there are so many things that needs to be fixed. Now, if you say you want to appoint a CEO with the problem that the entity has, then we are going down to drains. The first thing was to clean the house, fixing all the errors that were there, and then you deal with the matter of appointing the CEO, of which we've dealt with that one. One of that thing was that it doesn't make sense if the CEO of the small entity is equal to a level of the HOD of the department. Now, part of the thing was to say, let's go for benchmarking, checking if is it in line with other entities. Yes, you find that it is in line with other entities, but it's different. In what aspect? In the aspect of that some entities, they've got a revenue that they are creating to make sure that they can sustain and pay their CEOs. So we have to make sure that we check all that, fix all those matters, downgrade it if need be, checking the fiscal and incentives of the entity. But I must put assured that even if we don't have a permanent CEO, with the one we have, everything is going according to the resolutions, the plans, and everything that we seek to put the direction of the entity. Thank you.
Thank you. Let's just talk about financial statements and the audit findings. Now, there were those officials responsible for submitting misstated financial statements. What consequence management steps have been taken against them? And given the repeat audit findings, has the department conducted any external forensic audits to identify any systemic financial mismanagement? Over to you.
Through you, Chair. Can I put that one to the CEO, to the acting CEO?
I thank you. Honorable, the entity did react in terms of the quality of the financial statements that were submitted to AG, and during the evaluation, the responsible official was reprimanded and was the only official who scored a very low mark in terms of performance, and that was the consequence in terms of performance. But in terms of then correcting the issues going forward, the officials are being trained. They've already gone to a 2 weeks course to enhance their skills, as well as the chief director at Provincial Treasury is assisting us in training again the same officials that prepare the financial statements.
I'm not very clear about the part where you said reprimanded. Are you saying that the only consequence was just getting a poor rating for submitting these misstated financial statements? You may answer.
Yes, that's how it was treated. It was treated in terms of performance, as these were their KRAs, and the KRAs were detailed that they will achieve this, and they never achieved it. And that's how it was done.
Do you think that that was appropriate? Or do you think that there should have been a harsher consequence? Because considering, you know, these affect, the findings have been repeated.
I wouldn't say it was appropriate and it was efficient, but the previous financial year, the entity got a clean audit, and the three previous financial years, the same thing happened. And it's only the last financial year that this occurred, and we are working hard to take it out, and it should never happen again.
So you are confident that the measures you're putting in place, that this will not happen again?
Definitely. Thank you.
So let's just talk a little bit about the irregular expenditure and financial accountability. The department reported 1.36 million in irregular expenditure, but later identified an additional 7.98 million. Why was this discrepancy not detected earlier? And how many officials have been held accountable for this irregular expenditure? Has any portion of this amount been recovered? And if so, how much? Over to you.
Well, the irregular expenditure report, the amount that was recorded by officials and the amount that was discovered by the Auditor General relates to some of the issues that were not correctly recorded, like the issue of activities launching the NSF funding. That payment was recorded as a project expenditure when it was catering for the launch. So these issues do not relate to fraud per se. It's misallocation, because the event did happen. The service provider was appointed. There were 1,000 of unemployed graduates that were appointed, and they were in one place being orientated and addressed by the MEC. But a lot of these issues, some of them don't relate to fraud. They relate to not posting the amounts correctly, or not correctly recording the expiring of the contract and continuing with an expired contract. We have the details of all the irregular expenditure, and we have the loss control committee looking at them.
All right, because that's a discrepancy of approximately 6 million, and you've mentioned one explanation. Please, those reports need to be sent to us so that we have a breakdown of exactly what is going on there. Okay. You didn't mention how many officials have been held accountable for this.
Well, at my level, I only know the CFO. But at her level, then maybe she can say how many, because she does the financial statement, the statements to the financial manager and other officials down. I haven't orientated myself in terms of the levels below her. But at my level, I am aware.
Who's the CFO?
It's Miss Kzn. Thank you.
CFO can answer, and also just cover the what portion of this amount has been recovered.
Sorry, Honorable Member, is this relating to the regular expenditure that I must answer to? Or the?
That's correct. Do you want me to repeat the question?
No, it's fine. In terms of the irregular expenditure, there were SCM related issues where, in fact, let me just clarify, in terms of us not providing sufficient information to the team, we apologize for that, but our report was linked to the HG improvement plan, which we also submitted. So we were hoping to read them in conjunction. But these items are elaborated on in the HG improvement plan. In terms of the irregular expenditure, as we've asked, there were items that were identified prior to the audit, those related to SCM, where the suppliers or service providers had given the ADA incorrect information, and we failed to verify that this information was incorrect. But now we verify every certificate that we get, we verify to ensure that this does not happen again. Previously, we used to rely on what they provided us in terms of the documentation. Now we make sure that we verify what they have provided to us as far as we can. And then in terms of the other irregular expenditure that was recorded, the one that was recorded later, picked up by AG, there it related to the failure to actually seek relevant approvals for changes in the budget. So in other words, there were some reallocations that were done without the necessary approvals, without the relevant approvals. So that is why. And then further engagements with the AG as well. But as acting CEO has indicated, these are being finalized. The LOS committee has set, and then they've provided a report in terms of all the consequence management that needs to happen. And as she has indicated, that the report is to be submitted to the board for them to approve, and then and also endorse the necessary action that needs to be taken.
All right, that's fine, but how many officials have been held accountable? According to the HOD, it's just the CFO. Is that you, or was that a previous CFO?
That's myself in terms of, yeah, but there are other officials. For example, there are other SCM officials as well that have been held accountable. And also there are other finance officials that have been.
But can you explain how something like this happened under your watch?
For example, the SCM ones, as I've explained, that there were those issues where we needed to ensure that we do the necessary checks.
But I mean, why would you allow something without the necessary approvals? Being the CFO, you're aware of what the approvals and what the steps are. Why would you allow something like that under your watch?
It was picked up, but the problem is when we picked it up, it was, what can I say? Let me say it was, excuse me, it was an error in that thing. Errors do happen, and we do get punished for those. So yeah.
Errors totaling 6 million, approximately 6 million.
It's just that the figures were big. So what happened is that there were transfers from one program to the other, and those were huge amounts. It's not that it's a number of many items that were happening. It was one huge amount that took place. So it was, yeah, quite a huge amount.
I'm afraid that explanation is just simply not good enough. What you are giving us here, it's just not good enough. And I wish we had the details of that report and the breakdown to see exactly what transpired with regards to this amount. But let's move along. In terms of the debtors and receivables, why was the provision for impairment of debtors incorrectly calculated in prior years? And what percentage of the 43 million rand in receivables is considered recoverable? Yeah, over to you.
As the CE has explained, that we changed our accounting policy in terms of accounting for the receivables, in fact, for the provision. In the previous year, AG had indicated that our policy was challengeable in the sense that we could not vouch on how we had actually arrived at the way we had arrived at the provision was challengeable. in the sense that it could have been indicated that we had thumb-sucked those figures. So in the last financial year, we now had proper tables. For example, we would say if somebody has not paid in the last financial year, then we decide a percentage in terms of how to calculate the amount. Now, what had happened is that whilst we were doing that, there were commissions that we made, in the sense that there are certain items where we had said, excuse me, for example, these will not be part of the provision. So there were errors of commission to say there are amounts that was not supposed to be part of the provision. So those then were extrapolated. They picked up a few, and AG extrapolated those to say, then our provision for doubtful debts was shaky. So then we revisited the population to check each and every amount. That amount that AG indicated was an extrapolated amount. We did revisit the population, and we corrected all those that were
So
incorrect.
you put measures in place to prevent this from happening again?
Yes.
All right, let's move along to the final question. Dealing with maladministration and investigations. The independent investigation into maladministration and corruption covered 2018 to 2024. What were the key findings in this report? And what is the total monetary value of losses identified in the investigation? And finally, how many officials have been implicated and what disciplinary actions have been taken? Thank you.
Honorable Chairperson, I'm sorry, thank you. Honorable Member, I cannot go into details of the report because it's still embargo, but the total amount that is in the report itself is 23.3 million. But there is 1.4 million that relates directly to an official, and 100 and something that relates to the beneficiary. The beneficiary has already received a letter that he needs to pay back the money, but with the officials, we are busy with that process, which will be started this week, but hopefully the officials will get their letters before the end of next week. In terms of the number of officials, so far the report is given us 3 ADA officials. Thank you.
Thank you, Chair. I'm done.
Thank you. Start off to Honourable Dirks, who's been waiting patiently.
Thank you, Chairperson. I was not going to ask this question, but it just pricked my interest when the CFO responded to the last honourable member. Can you please just clarify this for me? You say that we do pick up errors, and then you made a comment, and we do get punished. What do you mean by that? We do get punished. Who gets punished when you pick up these errors? This was your response to her. No, we do pick up these errors and we do get punished. Who gets punished?
No, Chair, I mean, we do make errors. I didn't say we pick, yeah.
Then you said we can listen to the record. You said we do get punished.
Yes, for the errors that we make.
Who gets punished for those errors?
As we've indicated that the investigations are carried out, and then those who are...
You said we do get punished. Who gets punished?
Officials.
Oh. I know, you know... Anyone got punished?
Yes, there are disciplinary hearings that happen, and there are also, depending on the severity of the matter, yeah, and there are sanctions that are given.
See, I've decided I'm not going to ask any questions because you you are not prepared. You did not come prepared here to come and face this committee. You are not well prepared to come and face this committee to answer these questions. So I decided that I will not ask questions, but I just asked one question because of what you have said. I want to be fair with every entity, with every department. I would like to be fair with you all, but I must say you are not prepared. You came unprepared here. Maybe I understand is the chairperson of the board here? Yes. The only question I was going to ask early on, but the chairperson of the board answered me that the board came in September. So September, October, November, December, 3 months. So it's a new board. I understand the history of ADA. It's got a history of instability, acting positions never getting filled. And I blame it to a large extent to politics. The politics in this legislature, the politics in the province, the governing party at that time, procrastinating to appoint people, and it caused a lot of instability in that organization. I understand the history very well, so I don't want to be unfair to you all. But you can't come unprepared like this to answer questions. When you come here, you have to be prepared to answer the questions. And I think it's important to note these questions these honorable members ask, deal with those issues, because the questions are going to come back again a year later on. You're going to be here, and then we're not going to be like this here, so gentle on about this thing here, because you'll have heard these issues that they have raised, address those issues that they have raised. The chairperson before you came was appointed as the chairperson. Were you previously on the board? So you knew, absolutely knew this organization. This organization was full of problems. So you knew the acting chief executive. You knew too where you come from. Were you part of ADA? Came after the board. So you all are new here. The CFO. How long are you here? More than 5. So you've been in this organization as a CFO. So you're supposed to at least have given some solid answers. So the board, I will appeal to the board, deal with these issues. Deal with these issues that the members have raised. Because next time you'll come here, it's not going to be like this here. But you are not prepared you came unprepared here. And I will not ask questions, but deal with these issues here. Thank you.
Thank you, Honourable Dirks. All right, so I just want to get into some issues from my side. Sorry, Dr. Biela, I believe your hand is up.
Greetings again, Chair. No, it's an old hand. In fact, the Honourable Dirks has partly covered what I wanted to say. In the main, it's that the new board really has a big responsibility before it, and I'm glad that the Honourable Dirks has probed those questions to give context and understanding that they are relatively new in the positions that they currently occupy. But yeah, I don't think at this point I would want to probe any more questions to them, but rather maybe to even appreciate the responses that they've given thus far, given their limited time in office as yet. Thank you.
Thank you. Are there any other hands on the online system? No. All right. So, Acting CEO, you know that we obviously work with SIU. And I just want to know whether you've got a problem in the in your entity with staff not completing their annual financial disclosures. Do you have a problem with that?
I haven't checked whether they did complete. We were going to start in April to disclose because for this financial year, we are expected to disclose by end of
So
April.
you're not sure. No, that's fair enough. I mean, I'll tell you why. Please look at it. because I've got a list here as long as my arm from SRU. And it identifies the folks as from Department of Agriculture. So it's quite possibly not your lot, but you fall under Department of Agriculture. So I've got a long list here. I mean, it's about 200, plus minus, about 200 employees of Department of Agriculture that is a failure to complete and submit annual financial disclosures, something we were discussing earlier on the last department we saw. So it seems to be a major systemic problem in the agricultural ecosystem. So, and as I say, it's probably around about 150 people. Some of them I'm not saying they're all yours, okay, but Department of Agriculture. So unfortunately, it doesn't define whether it's you or them or just right across the board. So I'm going to obviously raise it now in the meeting we've got. So please just check if that's a problem. Then tell me something, man. So how many investigations are going to come out of this report that you got in mid-December? How many, not investigations, the investigation's been done. How many disciplinary matters are going to come out of that? Because surely look, by trade, I'm a forensic financial investigator myself. So I would have made recommendations in that report that you should take action against 1, 2, 3, 4, 5, 6, 7, you know? So how many are going to come out of that?
Thank you very much, Chair.
Give me a number.
Well, I can't give you a number. Currently,
you see, but that makes me very worried because you've been looking at this report for 2.5 months. Come on, man.
No, Chair.
Yeah.
Let me explain because you're asking me.
Okay. All right.
Then even if I can a wrong vote, maybe I'll have a last good vote.
Okay.
Yes. Now, I'm trying to say we cannot have the exact number how many people, but currently, according to the report gives us 3. Under those reports, there are subordinates that we can still go on. But currently, the number that you have is only 3. Okay. That's why I'm saying we can't exactly say. Maybe you'll find that the whole entity will be investigated. So that's why I've said, but for now, we've got 3. Thank you, Chair.
All right. No, okay, that's fine. And you say, Acting CEO, you said this report is embargoed.
In terms of it being discussed in the open meeting like this one, I can't discuss the details.
That's the call of the MEC, or is it the call of the OTP? Who did the investigation for you? OTP, or was it outsourced?
It was outsourced through DART, through the department.
To the department?
Yes.
So it effectively belongs to the MEC then?
Yes, but
so we should ask the MEC for that report if we want to see it. All right. HOD, what do you say?
No, Honorable Chair, I think your last summation is correct. The Honorable MEC owns the report and...
Okay.
Yeah.
Yeah, all right. That's all I've got. Members of the Portfolio Committee, are there any questions there? Please, they must be Scopa questions. We are also running very late on time. So please, not questions about strategic direction or policy or operational matters. If you've got any finance or Scopa questions, do you have any of those that you'd like to ask? Please, sorry, I'm not sure of the names, but please, if you could introduce yourselves and then just ask the question. Thank you. I don't know who's going to go first. Okay. All right. Karen?
Thank you, Chair. I won't be long.
Sure.
I want to go to 11.2024 for the progress of a report for the appointment of CEO. Thank you, Tuye, that's because the time is running. First quarter is running sooner already. If kungasho much, we'll appoint you. Okay, what I want to ask about this underspending conditional grant. I can see was 34 million, but now we left with 10 million. What I want to ask, did you identify the beneficiary for this 10 million? As like now, we got like 34 days left for the first quarter to spend that grant. And secondly, I just want to give you some advice. Mtungwa, Makumalo. I think to spend that money, I think you must focus on agro processes because you can get a lot of a beneficiary. Like you can create a job creation, especially in KZN, because in Zoyami, my heart is crying. Because if you don't spend this 10 million, that money is gonna go back. And we got 11 region in KZN. Definitely sure you must try and spend that money because no. Asikwazi ukuthi ngabele emuva. Abantu balambile. People they got projects. If you can focus on this agro processing, because there you can create job opportunities. There's a product, there's a harvest, there's a cleaner, there's a packer, there's everything where you can spend that money. Only that I just want to say ukuthi ayingabuyeli emuva. Ngiyabona ukuthi ziyakhala induku sanda kuyifikela kodwa ke Mtungwa nami ngithi nje cha ngihlabulisa ukuthi impela just please and focus to those projects.
Is there a question here somewhere, please? I really need to ask you to be disciplined. Thank you, member.
Thank you, Chairperson. Mine is very short. I want just to request for a written report on resolution 145, 146, then 147/2024. And we need this written resolution at least by end of June. This written report by end of June, because most of the time siyakhuluma nje, but there's nothing written. So please can I request that written report?
Yes, that will be provided. Kabo, you've got all the queries that we're going to put to Ada, am I right? Okay, so yes, you will receive a correspondence from us and asked to provide information. MEC, may I ask you a quick question, if you don't mind? The report, the forensic investigations report that has been received by Ada in December, can Scopa have sight of that report or not? Okay, all right. So we will, through official channels, request a report as well. But obviously we understand the sensitivity of the report, and we will certainly not be putting it out in the media, but just so we can have an sense of what is happening. All right. Colleagues, I think that's it now for Ada. We will now go on to the agriculture hearing. So with that, and I'd like to welcome the MEC. Thank you very much for joining us. And obviously we will lead off with the MEC when we meet with agriculture, the actual department with DARD. But for now, Ada, thank you very much. Like everybody else, we encourage you to be the best you possibly can be. We're here to support you. Yes, we ask tough questions. Okay, and we seem to be very harsh, but it's because it's what they say, tough love, eh? So we just want you to be the best you can. So we encourage you to keep at it, and we will talk in due course. Thank you very much. The ADA meeting is now adjourned. Are we going to take lunch now, or should we move to agriculture? Members? Lunch is still going to be there. Should we continue? Should we take a small comfort break? Okay, 5 minutes comfort break, and then we can continue with agriculture. And when we're done, we can have some lunch. It might be a slightly late lunch, but is that all right? Let me see, are you comfortable with that? Okay. Ada, sorry, my friends from Ada, sorry, hello. Lunch is available for you down in the dining hall. Okay. All right. So there's an incentive. The quicker we can finish, the quicker we can eat. Thanks, members. Okay, so the time now is 14:03 by my clock on my laptop. So we will start at 14:10. Is that okay? All right, 7 minutes. Thank you very much. All right, welcome everybody back to our final session of the day. We've been going since 9 o'clock this morning, and I thank you all for your time and your attention. The numbers are dwindling, but I'm told that we'll still call it on the platform, and other members are here but not in the room right now, and will return shortly. So we're now dealing with DARD, the Department of Rural Development, Agriculture and Rural Development. And we welcome you, MEC. Thank you very much for joining us. And we welcome the HOD and the CFO. And well, you'll have an opportunity to introduce yourself shortly. Here we have myself, Tim Bradisett. I'm the chair of Scopa. We have Honourable de Klerk, who is also a member of the Scopa committee. We have Honourable Twala, member of Scopa. We have Honourable Dirks, member of Scopa. And then we have two members from the portfolio committee who joined us, and then obviously officials. So, MEC, I don't know if you want to just go around this way, and then, so everybody can introduce themselves, and then we can get started. Thank you, MEC.
Thank you, Honorable Chair, colleagues or officials. I wish to first apologize for coming this time because I was supposed to be attending the first session with ADA, but I was having a commitment that I could not lose to attend. But yeah, I'm happy that I'm here, but HOD was here. It's going to give me the report, and then we are going to look at what you have raised and make sure that we correct those things that you need to be corrected. But with me, I will allow the HOD to introduce the theme, and then we take it from there. Thank you.
Yeah, HOD, let's everybody introduce themselves. That's fine, but you can start with you. Thank you.
Good afternoon, Honorable Chair and Honorable Members, Honorable MEC. My name is Zibusi Dlamini, the Head of Department.
Good afternoon, Chair, Honourable Members. Eckhard Habermann, the Acting CFO.
Good morning, Honourable Chair and Members. I'm Baba Lwapotlani, Director, Internal Control and Risk Management.
Okay. All right. Our normal procedure now, MEC, is that I'll give you some minutes if you'd like to address the committee on any issues you'd like to address us on. And then from there, we will go to the department for their presentation. So if there are any issues you'd like to comment on or on what we're going to be doing now, agriculture and rural development. Over to you, MEC. Thank you.
Thank you, Honorable Chairperson. Given some few minutes, I think we are pleased to be invited here. With the item that we raised previously, I hope we've ticked most or all of the boxes that we're supposed to be ticked. And where there are problems, I don't see any problems so far, but I'm saying that we are also, because at the end of the day, we're the one that are giving money to ADA. We're going also to make sure that we take responsibility. I hope you have seen Mr. Mfusi here. I have decided that he assist ADA with some of the activities so that we take it forward. So unfortunately, our CFO is on leave, but the acting one, I think he is also equal to the task. We are a team and we are going to make it. I don't see any problem so far. Thank you.
Thank you, MEC. All right, so we will now proceed to your presentations. But before we do that, I think you've all taken the oath, right? You've all done that when we had ADA, so there's no need to do that again. So HOD, of course, yes, sorry. Sorry, we just need to get you on record. So either the oath or the affirmation, so just raise your right hand. And I, in your name, hereby undertake to tell the truth, whole truth, nothing but the truth, so help me God, or I affirm to do that. Okay, whichever you prefer.
I, Baba Lwapotlani, I affirm to tell the truth, nothing else but the truth, so help me God.
Thank you. All right, I think we are now compliant. Honourable Dirks, we are compliant. The Honourable Dirks is the police of the oaths. He watches them very, very closely. Okay. HOD, over to you then. Can I please ask that you don't read what you've sent us? We have it. It's up there. But just give us the highlights. But don't go through too quickly. I'm not rushing you for time. But it's just a bit irritating if somebody just reads you a document that you've read yourself. So just take us through the issues that you've addressed, and let's go for that. And then please, as you go through, please just say, we're on resolution 140, we're on page this, just so it's easy for the members to follow. Okay. Thank you very much. I don't know if you're answering the question or your CFO. Entirely up to you how to manage that. Thank you.
No, thank you very much, Honorable Chair. The CFO is going to run through the presentation. We'll then handle the questions.
Thank you, Chair. Honourable members, thank you for the opportunity to give you feedback on the resolutions. Chair, in terms of the responses, we've provided a separate response for resolution 139 and 140. But I wish to deal with it as one because they both deal with the contract management issue. Because of the lack of contract management, it ended up with irregular expenditure. So I will just highlight in terms of what has the department done in terms of responding to that particular finding. Is that better? Sure. Chair, then in terms of the contract management issue, what was found is that there was a contract mainly on the security services where it was extended after the expiry date. So there was a lack of control around the contract management, and if there's a need to extend or renew, that it's done on time. Chair, we then as a department, we relooked at some of the controls we have and how to then improve on those. We did have an existing contract review committee that then looks at all the contracts and the renewal of it. It was chaired by the director of SCM that's been elevated to be the CFO to chair that particular committee. Together with that, we also looked at our electronic system that we have, enhancing that one so that it now flags the contracts within 6 months of expiry. So it already flags it for us so we can then take note of those and then take action. In terms of the monthly reporting, we're also doing monthly reporting now, where the contract management unit provides a report through the CFO to the HOD, highlighting which contracts, and a summary will then again, the focus is on identifying those that will expire within the next 6 months, 3 months, 2 months, that kind of information. And then also, Chair, is the national e-tender system. They've also now provided a platform where we can load up our contracts. So again, it's another platform where both us can have a look at it, as well as our Treasury can also have a look and maybe also then flag contracts for the department that might be expiring. We feel that those actions implemented, obviously at CFO level, it's closer to EXCO. We can report on it. Risk Management Committee gets reported on quarterly basis. Also, Chair, we then use our internal processes like our monthly IYMs, quarterly review of budgets. We don't just look at the expenditure. We also got SCM on board. So we also look at SCM issues, including issues of contracts. When will they expire? Do end users still require those or not? So that we can address them on time. Chair, that then deals with those two resolutions. I will then move to resolution 141, which deals with the irregular expenditure of prior years, where the financial statements had indicated 501 million of irregular expenditure. In particular, the committee wanted to know progress made in terms of condonation. Chair, I can share with the committee that Treasury has looked at our inputs. They have given us confirmation of a condonation of 128 million. There's a further 9 million that they are referring to the HOD, can be within the HOD's delegation to condone those. So that's good progress. At this stage, Chair, we are sitting with about 42 million that we are still dealing with it internally. The rest of it is already with our Treasury. So again, we're hoping we'll still make more progress in the 128 between now and the end of the financial year. Chair, I then move to the resolution 142. It was the issue around KwaZulu-Natal College, and where a subcontractor removed a generator. And the recommendation was that we should recover the monies. I can report that as a department, when Department of Works, who's our implementing agent, When they invoiced us for the next payment, we then reduced that invoice by the 1.28 million, which was for the generator. And then the issue has been resolved by Public Works Chair. The contractor is back on site. The subcontractor has been paid, and the generator has been installed again at the college. So I think that matter from our side is resolved, Chair. Then I think the last one, Chair, is the issue around material irregularity, Resolution 143. This is the issue where we had a investigation done, where we paid for infrastructure that wasn't done to standard. Chair, I think the update there is that it's still at litigation. We have done disciplinary action against 2 officials. Chair, those officials were, one of them was within finance, and in terms of the processing of the payment, some of the checks weren't done, so he was given a warning. And then the other ones, the department is then still pursuing through SAPS. We gave you the case number. Subsequently, it has now been handed over to the Hawks, so we will be following up on the investigation on that one, where we're then seeking for criminal recovery through that process. Chair, what have we done to prevent similar incidences? In terms of all infrastructure, in terms of our delegations, we now brought in a step where the chief engineer or the director engineering services has to sign off the payment before it goes to the accounting officer or the CFO. So it's not just at ground level for the engineering, but also at the highest level at head office. They will look at the payments, they will look at the receipts, etc., and then endorse it to then give the green light that everything is in order in terms of the standards of infrastructure. Chair, I think those are then the resolutions that we're responding to. Thank you very much.
All right. Members, before it slips my mind, I just want to jump in on one quick question, if you don't mind, members. It refers back to our meeting with social development. Social development, there was a resolution there that they were dealing with some of their investigations as well. And there was a particular investigation relating to 3 officials that were involved in cover quoting, which amounted to 72 million rand. 72,800,000 exactly. The reference is FR 36/2009. Now, DSD informed us that of the 3 officials implicated, 1 is deceased and the other 2 have moved over to DOD, and that the investigation was referred over to your department. And I believe it literally says here, the disciplinary matter referred to the new department. 1 criminal case has been opened, and there's another criminal case opened, I think. They seem to be the same case number. And so there was civil recovery against 1 of the accused, and the curator was authorized to facilitate one of the accused house, but there was nothing to be got there because there was no equity. So I just want to know, can you just give us some advice there on that? Can we just start there, please? Because that's something of great interest to a lot of people as to what's happening with that matter. So I want to make sure that it's not this revolving door where people leave one department, go to another one, and the whole thing dies. Can you just let us know, the HOD, what's going on there, please, if you can?
Thank you, Honourable Chair. Yes, the cases were subsequently referred to us, but this happened in 2021, around February, especially the case for Mr. Memela.
Mr. Who?
Mr. Memela.
Memela, yeah.
Yeah, whom we then started the process for disciplinary hearing, and the service provider that was implicated in the collusion unfortunately refused to participate in our processes. And we unfortunately, around August last year, Mr. Memela passed on. So that's how that case was then closed. The other case was for Mr. Hadebe, who was also transferred from DSD around the same issues, but the report was also furnished to the department in February 2021. By that time, Mr. Hadebe had left the employ of the department as well.
Your department or DSD?
The Department of Agriculture as well, Chair.
Okay, and the third official?
Those are the only two officials from.
So the first one passed on before.
Yeah, the second one left before, but because we got the documents around 2021.
Okay, right, I understand. So the first person passed on. The second one, that is Mamela.
That's the first one, Mr. Mamela, that passed on, Chair.
Is my maths bad here? There were three officials. One has passed on.
We only give.
You spoke about Khadebe. Is there a third one?
No. From the department side, we only given two.
Only two came over. That's right, yes. So what I'm saying is, so the other official that was still with DST passed on while they were still with DST.
No,
you don't know.
We don't know that case. Yeah.
You don't know that case.
Yeah.
All right. So are you left then with only Mr. Khadebe, who has left the department now?
He had already resigned by August 2018. Right. So we got the documents in 2021, but he was no longer in the employ of the department.
Is Mr. Khadebe the one you were trying to sell his house? Was that the other person who passed away?
No, the other person who passed away, that's the one we tried to implement disciplinary processes.
Was that Mr. Mamela?
Mr. Mamela.
Okay.
Yeah, but the service provider that was involved in the collusion then refused to participate.
And then what civil recovery is being attempted against Mr. Khadebe and what criminal action against him? He may have left the department, but he still has to answer a criminal case, doesn't he?
Yeah, that Chair understanding that would have been DSD to then institute recoveries from their side, because we were only taking care of the disciplinary processes or officials in our employ.
Okay, so who is running these two cases? PMB CAS 212 of 5 of 10. Is anybody paying any attention to these case numbers? I literally have them here. And obviously there might have been DSD. I'm just trying to find out. Somebody needs to be keeping an eye on these two case numbers and find out if anything's happening, even if only one person remains.
Yeah, definitely it will be DSD, Chair, because they suffered the loss and they'll have an interest to recover the monies that are owing to the department.
So was it only transferred to DARD simply because you paid these two individuals and therefore would have some control over them for disciplinaries and that sort of thing?
That's correct, Chair.
Because it actually isn't really your problem.
No, it's not a problem.
You inherited it.
Yeah.
Is that fair to say?
That's correct, Chair.
Do you have an idea of what happened? This cover quoting.
Well,
what the actual scheme was. What was the scam? Do you know?
We wouldn't have the full details, Chair. Just besides that, we do understand that when they were running events, there was payments that were inflated, or there was a scheme to try and pay over or as a gratuity to some of the employees. And that's what we're following up in terms of the disciplinary process. But the actual details will obviously be part of the forensic or the investigations that was done by DSD.
So was it that old scheme where you have 3 suppliers and then they decide, okay, this one you're going to get, this one you're going to get, and so it works like that. And then the officials involved get some sort of a kickback out of it.
I think, Chair,
do you know that, or am I asking you to speculate?
We wouldn't know the details, and okay, it probably would not be fair for us to be wanting to account for on behalf of DSD as well.
Can we please make a point to chase that up with DSD when they respond? Because they did a rugby pass out of the scrum to the wing and tried to miss the whole back line and actually passed it on to you, but in actual fact, it's not your issue. All right, so we need to follow up on that. All right. Then, if the other members are not objecting, let me just go a little bit further. I'm a bit concerned. We obviously work with the SIU, and I've got a list as long as my arm from the SIU here. It's around about 150 employees of Department of Agriculture, right? And it's all KZN, and I literally have the names and the ID numbers and all that. Do you have a massive problem with failure to complete and submit annual financial disclosures? Because according to DSD, you have a massive problem with that. And I've got the full list here. As I say, I've got names, ID numbers. Is that a problem?
Chair, not with our department. Disclosures, we should all be in the clear for Department of Agriculture.
Department of Agriculture.
Yeah.
Regulation 9 of 2017, Department of Agriculture, and it says DOAREGFCM2 KZN. Department of Agriculture. Then it says the person's name, their ID number, and then the date submitted. These are all from 2019, it appears. And it's DOD DC Col / 78 / office, and it says failure to complete and submit annual financial disclosures. And there's about 150 here.
No, Chair, maybe if we can be finished with the report, because it might also be the National Department of Agriculture, because we do have a very...
I thought that might be the case, because on this list they are. This is what we got from the SIU after meeting with them in December last year. They said they would send us all their referrals. So they have now referred, I don't know if you referred it to them or whatever, and I thought it might be the case, but then I'm confused about the project code for all of these. The project code is DOAREGFCM2 KZN.
Yeah, maybe it's their case, because they also have a provincial office in
okay, possible.
Well, it's probably their office, but we do know in our records we comply.
All right, I will send this whole list to you. There are other issues as well. There's failure to, there's just misconduct and that sort of thing. So I will ask them for an explanation of that, and I will send it to you just to see if these are any of your folk. Okay, that's what I'm concerned about. All right. Sorry. Okay, so CFO, you'll get this. You'll see there's it's a spreadsheet. It's got disciplinary spreadsheet, criminal matters, civil litigation, admin action. I think you guys only came up on the disciplinary spreadsheet. Okay, right. Now that I've had first bites at it, members, anything from your side? No takers. Are we that happy with this department? Weren't you, Honourable Dirks, the first time we met this department, weren't you very concerned about security companies, and are you happy now? That's impossible. You can't be happy.
No, I'm not. Sure. I'm not happy. I'm not happy.
Do you have any questions about that issue?
Ask them questions now. Let them continue, Chair. Chair, you know what you do, Chair. When we came in here, Chair, we raised issue very aggressively. And we raise it aggressively, and we say go and fix these things, and we want answers to it. And with the AG is going to give we'll get another report from the AG very soon. They're going to appear here again, and then when we then deal with these issues very harshly, then nobody must say that we are personal about these issues here. That we are personal about it, because we have raised it, we have asked them to go and deal with it. You're not dealing with it, it comes back to us and we will deal with it. That's the position, stance that we have taken as Umkhonto. We'll deal with these issues here. We have raised it. You saw the other day in education, we said nothing. We just looked at them because we have raised the issues. They must not say we're unfair to them. We said nothing. We raised it very strongly the first meeting. 6 months later on, said nothing to them. We looked observing them. They are coming to appear again, and we're going to raise these issues here. Same with this department. We have not forgotten the issues. We are very, very clear that those issues has not been addressed about the security companies. We know exactly what's happening with security companies in that department, and we're going to deal with it very, very soon. Thank you very much.
Okay. Those issues about contract management and the security companies that were raised, are you confident now that we don't have these evergreen contracts happening, HOD, that we are getting on top of it and renewing contracts properly?
Definitely, Honorable Chair, we are on top of it. It was one issue after quite a long history of a clean audit as well, at least about 2 of them. And then we regressed, but it was just this one particular issue. And even in the same issue, it was a matter of misunderstanding and misinterpretation, as we had explained, but we are on top of it. The fact that the CFO now is the chairperson of the contract review committee, it just speaks to the magnitude with which we take the matters seriously, because then as the HOD, I'm able to get periodic reports on which contracts are about to expire and what has been done with those. We've even gone a step further that even the end users, even using the e-portal system, were able to send end users correspondence quite early about all the contracts that are due to expire, so that processes are implemented quite earlier on, Chair.
Honourable Clerk.
Chair, I know that the HOD and some of the other officials were here with the previous entity, ADA, where I complained about the quality of the reporting. I just want to highlight the following, that these resolutions speak to the Auditor General's queries. So coming on the next audit period, when is that? Before the 31st of May or something like that. Before that, this must actually be part of what is the evidence given to the Auditor General so that they give you a good outcome. So it is a good response, but it's still not good enough. It should be more detailed, like what you want the Auditor General to see. So, with that taken into account, I hope that in the future you will understand why it's so important in this committee to answer in detail, even if it means having a booklet, because you will then use that in your audit to show that you've dealt with that what is wrong. So that's all I wanted to say. Thank you, Chair.
Yeah, something else popped in my mind. How much do you owe Department of Public Works? As a client department, you owe...
Chair, we don't owe Public Works anything. We're one of the departments that pay on time, Public Works.
It's a question we forgot to ask Health this morning. We need to ask every single department, how much do you owe them? We should not forget that. Your response to resolution 143. Yes, MEC.
But Chair, I want to be frank to say, though we don't owe Public Works, we give them money as a implementing agent. Sometimes then they don't pay the client, and then the client will say, you are not paying us. But when you go through, find that, like we were having a query from Abakulusi, they said you are owing us. They wrote to me, but they said we pay everything to Public Works so that Public Works will pay them. And then if Public Works is not paying the institution, they will always complain as if agriculture is not paying, but we pay everything. I even spoke to the MEC or Honorable Mayor about it, then they sometimes when we pay, they will rob us to assist the other departments that are not paying.
Okay, that's something I think we should raise with Public Works. I'll certainly raise it with Honourable Mayor. Yeah. Okay. So resolution 143 of 24. It is relating to a forensic investigation. You say you attached the report. Did we receive the report? I have not had sight of that report. Kabul? Okay, so could you please get that report across to us? That's a report that was done by, in terms of section resolution 143.
Chair, if I can address, we'll have to check because as far as we understand, the report should have been part of all our submissions.
Okay, Cabo says he did not receive it.
All right, it can be forwarded again, but...
this is not the same report that Ada were talking about.
No, it's a different one.
Yeah, okay, but please, we really need that. I'm sure members would like to see it too. So that's two reports now, MEC. That report will come through and then the one from Ada. Please, thank you. So disciplinary action was taken against two officials. One had already retired. And then, so there's a criminal matter ongoing with Hilton. Okay, and there's a silver recovery ongoing. All right, well, thank you for that. But I think if we could just possibly have that report, that would be great. That was just a question. I didn't receive the report. That's all I've got. Members, are we good? Members of the Portfolio Committee, are you happy? You see what happens when you put lunch at the end of a meeting. Then it's so quicker. This whole day today, there were 100 questions. I'm just joking. But I'm not saying that the members are that shallow.
But Chair, next time, agriculture must be first, when we're still strong.
No problems. Members, I think I'm getting a sense that agriculture are taking these issues seriously and are attempting to, address the resolution of it, and I thank you for that. I thank you for that. I think it's encouraging. Let me just check on the online platform. No hands. So it's encouraging. Like all departments, we wish you all the best. We are here to administer tough love, but at the same time, we want every department to do incredibly well, because if you do well, our province does well. So thank you very much for your input and for your efforts, and hopefully we don't have to see each other soon. But if you could just get through, I think this has been quite a light session. If you can just send us that report, please, and that other ADA report. MEC has authorized it. MEC, are there you happy? No closing remarks? Okay. All right. With that, everybody, thanks so much for your time. That concludes our, with the exception of the transport, which will come along sometime, it includes our February Scopa hearings. Thank you for your time. It's been a bit of fun. We've been a bit of grumpiness, but we've got through it, and we'll wait until the next fight. Okay. Thank you, everybody. Meeting is adjourned.
Thank you, Chair. you.